Good morning, everyone. I'd like to call this Board of Supervisors meeting to order. The date is October 26th. The time is about 9:02 in the morning. Thank you all for being here. I'm going to please ask you to stand. I'm asking the former mayor of Ceres, Chris Vieira, to lead us in the Pledge of Allegiance, and then remain standing for an invocation from Cindy Marks of Pray Modesto.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Vito.
Thank you. I see lots of new faces up here, so welcome. Welcome to the Board of Supervisors. Heavenly Father, I come to you humbly asking for your grace and mercy to be upon us this day. I thank you for each one here and pray that you will guide them into all truth. You are a good God and promise that if any of us lacks wisdom, that you would come and give us wisdom liberally. We ask for wisdom for the times we live in and for your grace and for these our county leaders. You also said if we call upon you, you will answer us and show us great and mighty things which we do not know. I ask you for your comfort to be upon all who have lost loved ones and to heal their hearts. And lastly, I thank you for your bountiful rain that has cleared the air and is supplying the needed water for our crops and livelihood. I praise you for all your goodness to us and ask you to bless each family represented here today. Amen. Thank you.
Thank you, Chris. Thank you, Cindy. Plenty of seats. Come on in. Okay, before we get to public comment, we have a couple of presentations today. And then when we get to public comment, if you have an opportunity, please fill out one of these yellow speaker cards. You don't have to, but it just makes us a lot more efficient because I can call two names at a time. Casey Smith is walking around collecting them. I thought she was. I think she's around here. And if you just raise your hand, someone will come and grab them from you, if that's okay. So we're going to move on to the first presentation. It's a recognition of MTC Distribution upon their 100th anniversary. And I'm going to let Supervisor Withrow, Vice Chair Withrow, come down and do the presentation.
Okay, thank you very much. Tom, come on down here. So this is a good story. It's kind of what this country is all about, is what I think about. And I'm going to let Tom do most of the talking here about Modesto Tobacco and Candy and MTC and what they've done. And we're here to celebrate 100 years of them being in business here in our community, here in this county. And as I just looked really quickly, and I see the largest independent distributor west of the Mississippi. That's a big deal. And it's great to have this local, organic, homegrown business here in our county. And Tom is a great guy. I can tell you that. He's just a good human being. And I'm sure everybody from his company would tell you that. And so I'm very proud to have you here today, Tom. And I want you to talk just a little bit about your company and how you got here and where you're going.
Thank you, Terry. And thank you, Board, for this great honor. I truly appreciate it, not only for myself, but for the several employees that are at MTC today. Not only that, but the hundreds and hundreds of employees that have been part of MTC's history over the last 100 years. My grandfather came to this county in 1921, and he opened up a small storefront in Modesto. And that's how he got started. He had one employee, and it stayed that way for quite a while. And according to my dad, he was thrilled the first day in business. They did $9 in sales. So that was a that was really a big deal. Today, MTC employs well over 300 employees. Most of them are from this county, and sometime this year, next year, we will hit the $500 million mark in sales. So it's a fairly large, aggressive company, and I'm very proud of where the company has got to today. I wouldn't be here without the people from this county who have worked there. And not only that, is my management staff. Some of them are here today, and I would like to introduce them by the numbers. 44, 42, 40, 35, 30. That's how many years they've been with me at MTC Distributing. And I'm telling you, without their vision and their patience, this company wouldn't have made it over the last 18 months. And that really has been a challenge. I've been at MTC for about a half century, and this last 18 months was the hardest I've ever been in, by far. Lots and lots of challenges, and they remain today. I even read that we're having some supply chain issues. Imagine that. Our company, I think it was 4 days after Newsom, or Governor Newsom, had his shelter-in-place edict, we lost 25% of our business. Within 90 days, close to 60 of our employees basically left the company for be safe at home, and also to take advantage of some very lucrative programs for not working. So we truly have been part of all of this. And at this time, I would really like to thank the board and the Sheriff Dirksky. I know Sheriff was around here earlier. There's the Sheriff in your department. And the Stanislaus County Health Department. We have relied on you for your guidance and your support over the last 18 months. And you have really governed in a way that I felt was very level-headed and even-minded. I think you kept all of the people in this county safe, but you also allowed businesses like myself to at least try to survive. And that says a lot, and I'm coming from a little knowledge because we do business in almost every county in this state, and I'm telling you, not all counties are equal. There are some that we felt that they did not want us to do business in their county. So thank you, the board, and then there's Terry. So like everybody else, we have been challenged by the people who do not want to be vaccinated. And I'm going to tell you right now that those people who do not want to be vaccinated have the right to do and say whatever they want. And I'm not getting into politics here, but it is insane to me that somebody's going to tell me to fire some people who stood shoulder to shoulder with me when this COVID hit, that all you had to do is look at CNN and go, oh no, everybody, you got to stay home, you can't do this. Well, those very people who didn't get vaccinated stood shoulder to shoulder with me while others left. And when I told them, wait, we're an essential food distributor, you got to stay, they went, bye-bye, good luck. So I'm not telling any employee that you're going to be fired. I hope they'll choose to be vaccinated. I did. But I think you use reason, understanding, and then at the end of the day, it's up to them. It's their personal choice on what they want to do with their bodies. However, we had a group of, oh boy, it must have been 30 or 40 employees that chose not to be vaccinated for whatever reason. So we got a lot of great information from the Stanislaus County Health Department, thank you, and we presented it in a meeting, and we invited our supervisor, Terry, to come over. So he spoke, and all of our managers who were sitting in there insisted that it was the best thing that we could have done. He didn't threaten anybody. He just talked about his own personal experience. And the next week, half of those people went and got vaccinated. So we'd like you to come back for our night shift. We have some gaping holes there too. So anyway, I just wanted to thank all of you and the county government for the way you've handled this. We still have a lot of work to do, and I know that, but at least you can kind of see a little light at the end of the tunnel. And finally, this 100 years has had us do a lot of thinking. My daughter's fourth generation owner of MTC Distributing, and she and I had a long talk, and we felt this was the time to sell the company. So we are selling MTC to our employees. So our employees are going to end up owning this company, and this company has made my family's dreams come through for 100 years. So maybe it's our turn to make sure that for the next 100 years, those great folks, they got a chance to make their dreams come true. Anyway, thank you. Thank you so much. Thank you.
Thank you, Tom. Stay up here. We're going to take a picture here real quick. Stay up here. So on behalf of the Board of Supervisors, we'll give you this little certificate, and congratulations on your 100 years and all that you're doing.
Thank you.
Thank you very much, Tom.
Very nice. Tom, thanks for coming in. And I know that management, you guys have big shoes, right? Heavy weight on your shoulders. Been a very successful company. Appreciate it. Okay, we're going to move on to update number 2, or presentation, I'm sorry. It's an update from the Central Valley Association of Realtors on the current real estate market in Stanislaus County. And Pete, let's see if I can do this. Dyrewush, was that close? Dyrewush, President of the Central Valley Association of Realtors, is going to be presenting. Oh, and
Marjorie Burnell.
Marjorie Burnell, I see. I just have to keep reading, who's past president of the Central Valley Association of Realtors.
Thank you,
Thank you.
Supervisors, thank you, Board. Heard back from Mom. Condolences. So real quick, we had a meeting a few weeks ago, and Supervisor Withrow came to join us, and was a little shocked at the market update that we were presenting, and so asked if we would just come by and give you some updates on Stanislaus County. So for Stanislaus County, and I did not put a price limit on this, so this is going to be ranging from your $100,000 condos to your $1 million properties. Currently, and you know we're in the seller's market, right? You can't really buy a house for $400,000 right now without competing with 20 other people. So for Stanislaus County, no price limit. For the month of September, I ran these numbers as of last night. So we currently have, all throughout Stanislaus County, 447 houses on the market. That's not a lot of inventory for our county, our size. Last month in September, we closed 490 units, and currently in contract, we have 488 units in contract. So if we look at the numbers, our dollar per square foot currently, $272 a square foot. If we go back just 10 years, when I bought my house at the crash of the market, our houses were selling for $100 a square foot. It is really hard in our county to get our first-time home buyers into homes, and we're really, really striving for that. Both Pete and I are directors at the California Association of Realtors, so we really pay attention to what's going on. Our state has a problem. It's a nationwide problem, but we really wanted to bring it to you so that you actually had some data on what's going on here. So, days on market. We're in a competitive market throughout Stanislaus County right now. 15 days on market. So if you're looking to sell right now, your house will be on the market for 15 days and we'll get it sold. I think the biggest stat that is the most important is probably the amount of inventory and how long it would take for us to sell what's currently on the market. Currently, we have 0.09 months of inventory in our market. A normal market, which I don't even really know what a normal market is. I've been in for 15 years and I don't know what a normal market is. But I'm told a normal market is between 4 and 6 months of inventory. So when you're looking at 0.09 months versus what normal is, let's say 4 months of inventory, that's huge. So in the lower price points, if we're looking at a first-time home buyer price point, we are looking at 0.06 months of inventory, 0.06 of a month of inventory on the market currently. Dollar per square foot is holding steady at $283 a square foot. So I guess our point for being here is we need more inventory. I personally have been saying for a couple years now, and I think I talked to Supervisor Withrow about this before, I think we need senior housing. And not senior housing like the park that is very expensive. We need senior housing that our seniors. I have a VA couple right now who wants to sell their 2-story home but can't get into a single-story home because A, there's nowhere to go, and B, they're too pricey for them to try to sell what they have and get into at a price point and a payment that's comfortable for them. So first-time buyers and our seniors, I think, are where we really need to focus our attention. So that's it for me. I don't know if Pete wants to add some things. I'm sure he does. He always does.
Actually, it's just something simple, really. When we look at the shortage of inventory specifically, we look at, it's why we have such, it's all supply and demand. In the city of Paradise, we had all the fires. Hence, their building right now is crazy. It's also crazy because the cost of building is a lot less. The permitting is less. If we look at making building a lot easier in Modesto, allowing investors or builders to come in, reducing the cost of building permits in itself, and making it a lot easier, I think that's going to help us a great deal. But that's about it. Thank you.
Any questions for us at all?
You brought a bunch of really good news. This is
Are you
depressing.
trying to sell?
This is, well, but it's something that we've seen. We have a big push, and maybe I don't know if the CEO wants to respond, but we've been talking about just the lack of housing. It's very hard in the scheme of things because it's market driven, right? So the builders have to want to build. We only control components of it. Fees would be one of those, infrastructure, but not so much in the unincorporated area because there was an anti-growth measure that doesn't allow us to grow outside of the community plans that were pre-2000, I think it was 14 or 15. So it's very difficult. We've looked at opportunities to try and maybe go out to a vote and pick some areas. I know in Keys there's a couple of parcels that were outside the community plan that obviously should have been in the community plan. Denair has a little bit, some areas that I know. But we definitely need to get after on housing, but we need builders, and things are expensive. So even if there were no fees, housing is still very expensive on a per square foot basis based on the inputs, labor costs, and lumber and other things. So,
Yeah, I just want to thank you guys for coming in and presenting this for all of us to hear, and maybe Jody can speak to it too. But we do have this on our radar, and we do have a plan that we're working towards, and maybe Jody can talk about it a little bit here.
Yeah, thank you very much. Also want to thank you for being here and for everyone who's here this morning. And for members of the community who may not have been at our our board meeting a couple of weeks ago, we did present a program that we refer to as Housing Stanislaus. We've gone to 8 of our 9 cities at this point to spread this word of a program we've put together that will involve all stakeholders throughout the community, kind of in a sprint process over the next 10 to 12 months to develop a comprehensive strategy around addressing this shortage of housing on a long-term basis. So much of our efforts tend to get steered towards short-term and lower on the housing continuum as it relates to homelessness and so forth. We want to steer our focus strategically to the upper half of the housing continuum, to workforce housing, even rental housing, and home ownership. So we're going to invite you to that process, and we'll look forward to your participation. Thank you.
Happy to. All right.
Thank you.
Thank you,
very much
guys.
for coming in. Okay, now we're going to move on to item number 4, update related to the 2019 novel coronavirus, COVID-19 update. And CEO Hayes.
Yeah, I'm going to go ahead and kick us off this morning, if you don't mind. Good morning, everybody. My name is Jody Hayes. I serve as the county's Chief Executive Officer. And joining me in this presentation, as we do at most board meetings, is Mary Ann Lily Tengowski, our Health Services Agency Director, and the county's Public Health Officer, Dr. Julie Wation-Pine. I did want to, in this particular presentation, just make a quick comment. I have received a number of emails, and I was out of the office, so for those of you I haven't gotten back to, I apologize. It's not because we're not trying to respond to emails that we receive. But I do want you to know that one of the threads and themes that I've seen in much of the email correspondence over this last few days has been around access to county services for individuals based on vaccination status. And I know that that there are a number of topics of concern and interest that I'm sure we'll hear about in public comment today. But I did want to take just a moment to specifically comment on access to county services as it relates to vaccination status. I know that a lot of the written documents and information we receive from the state of California can be confusing. So it's important to us that we're actually very, very clear about our position and what we're doing here in Stanislaus County. So I just want to make a very definitive statement that vaccination status is not and will not be a requirement for obtaining or accessing services in Stanislaus County. So I just want to make sure that that's abundantly clear. That's not in place here, nor will it be in place. And with that, I'm going to go ahead and I'll go ahead and pass it off to our team here to go through some of the information. Thank you.
All right, good morning, everyone. I'm going to start out, as I usually do, talking about where we are with our transmission and our cases and hospitalizations. So here is the graph we show each time I'm here, and you can see our confirmed and probable cases with our confirmed in blue and our probable in green. And you can see our last summer surge, our winter surge, and our this summer surge. We have been coming down. It has clearly slowed, as everybody I think has seen. Unfortunately, we did report more cases last week than the week before, and we reported more cases yesterday than we did last Monday. If you remember, Monday is a 3-day report. It's including the weekend days. And so I don't know where we are right now. I'm not exactly happy that we've had a week of increased cases being seen, so I really hope we are not seeing some increased transmission. Hopefully this will just be a blip, and we will continue to decrease down to a further rate. But right now I can't really tell you what is going on with our cases, because we did see an increase last week. Small, but it certainly wasn't a decrease, and it was a small, like, you know, we had almost 1,000 cases last week, and it was about 50 or so more than the week before. So I put up this, our case rate graph that we look at. It's the 7-day average with the 7-day lag, and you can see you don't really see it going up, but it certainly looks like it's plateaued across the last week or two. So we'll continue to watch this. We plateaued, unfortunately, above 20. So we're waiting to see what's going to happen, see what happens this week and next week, and I think it'll tell us where we're going. As we look at our percent positive testing, it is plateaued as well, maybe increased a little bit, but I'm not sure I can really say that. I haven't seen that looking at numbers every day. So certainly seeing a plateau much higher than we were last spring. So hopefully we can continue our decrease and bring that down a bit and bring our case rate down. As we look at our hospitalizations, again, the same story. You can see our hospitals graphed beds in orange and our ICU in red. We are not doing bed pulls on the weekends, which is why you see the holes in the line now. But you can see we went up, we came down, and we kind of have been sitting at the same place again for the last couple weeks with both hospital and ICU. The hospital staying around 115 to 120 COVID in the hospital, and the ICU, in all the hospitals, I should say, and the ICU hanging, around 25 to 35, I would say. So we'll continue to watch this and see how we can do, but it would be nice to get certainly under 100 in our hospitals. And then we're going to look at our vaccination for Stanislaus County. So here's our daily rate of COVID vaccines administered to county residents each day. And as you can see, even with the Pfizer boosters being approved, a couple weeks ago, maybe it was a month by now, we really didn't see any increase in vaccine demand from those boosters, and we'll see if there's any demand from the new recommendation for boosters from Moderna and Johnson & Johnson. So I'm going to talk a little bit more about the boosters later, but you can see we're not giving a lot of vaccines. We've certainly gone under 1,000 a day, more like to 750, 800. That includes the pharmacies, everybody. If we look at our vaccine coverage by age group, you can see that overall, if you look at the 12-plus number, the second to right, 57.3% of eligible people in the county are vaccinated. For adults, sometimes that number gets thrown out, especially federally, so 59.2 is our number, with about another 9% with partially vaccinated, so a single dose of either Pfizer or Moderna. You can see by age group where we are. I put in the vaccines by cities because we talk about these with the cities a lot. So you can see Patterson continues to lead all our cities with 68% vaccinated, followed by Modesto. And then you can look at the rest of them. I guess Newman's next. So continue to see some variation by cities. As we look at boosters, so there's been a lot of news lately about boosters. So what is the bottom line? Because it's been quite confusing, I have to say, as it's coming out. So for Pfizer and Moderna, at least 6 months after their second dose, people age 65 and older, people age 50 to 64 at high risk for severe COVID-19, and then there's also an indication for age 18 plus years at high risk due to medical conditions or job exposure. They may get a booster after assessing individual risk. So those are the groups that have been approved. For the process, because the process, I have to say, is quite confusing, the advisory committee for FDA meets, and so that makes the news, and then the FDA has to make their recommendations, which they may or may not take what the advisory committee says. And then it goes to the CDC advisory committee, and then the CDC signs off. So these vaccines are available under the PrEP Act and emergency use, and so they can't be used and except as recommended by the CDC. So it's really a long process, and it keeps coming out in the news, and people get confused about when they're available and when they're not available. But it's a process that's in place through federal legislation, and just so you have a little bit of understanding of that process and why you keep seeing it in the news, but we keep saying, no, they're not available. So then Johnson & Johnson also got an approval for an extra dose. Johnson & Johnson recipients 18 and older, and it's 18 and older for Pfizer and Moderna as well, 2 months after the initial dose. So that's the booster doses that are allowed to be given. One other thing I should say about the PrEP Act, this is a federal program, so it follows all federal programs, so you can actually only use it this way. So these weren't allowed before this, so this is a permissive allowance of getting an extra dose for people who want more protection. It does not change the definition of fully vaccinated. Okay, so fully vaccinated is still 2 doses of 2 doses of Moderna or Pfizer and 1 dose of Johnson & Johnson. So that does not change. This is an allowable extra shot if you so desire. So they also approved last week, all the way through FDA and CDC, mix and match. So you can get any booster dose. I know, I'm sorry, I tried to make it as simple as possible. Any booster dose following any primary series. And I'd like to point out, the one booster dose that's actually different is Moderna. It's a half dose of the primary series. So if you got Pfizer, again, you can get Pfizer or Moderna or Johnson & Johnson. If you got Moderna, again, you can get any of the three. Johnson & Johnson, you can get any of the three. So it's supposed to be making it easier so that, you say, okay, well, I got Johnson & Johnson, but I really don't want that again, I want to get something else. You can now. And so that's, again, a permissive allowance here. It also helps as we go into places like long-term care facilities for vaccination. You could have people who have all different vaccines as their primary series. You don't need to carry all three around and try to figure out who got what and be looking it up. You can, if they would like, they could be boosted with any vaccine. So I wanted to go through schools, the masking and vaccination requirement. So the state mask requirements for school, as you know, this is a state health officer order that requires that we follow this in the guidance. In the guidance, it was written that it would be reassessed by November 1. And so they did this reassessment last week, and there's no change to the masking requirement for schools. So that's the masks. I wanted to bring forward that they did do that reassessment as was stated in the guidance. Then when we go to this vaccination requirement, which is the order of the governor, when vaccines have full FDA approval, so right now they don't have full FDA approval. This needs full biologic license, and right now it's only 16 and older with Pfizer that has their full biologic license. It's going to go through the state regulatory process, which requires medical and personal belief exemptions to be allowed. It's effective the term following the full FDA approval, which seems highly unlikely. It'll be January 1. July 1 more likely, just because there's not full FDA approval for the grade span of 7 through 12. It's phased in by grade span, so 7th through 12th, K through 6th. So I do get questions about vaccine for children 5 through 11, and FDA is actually meeting right now, their advisory committee, reviewing the data on that. I do want to say I haven't seen those data at all yet. People will all the time ask me what I think about this. I have no opinion yet. I have not been able to see the data and evaluate it, so I can't make any comment. As we look at immunity, so population immunity, everyone, for the most part, is going to get some level of immunity somehow eventually. I mean, who thinks that they don't have some level of immunity to flu? So I think there's two different ways. Well, I know there's two different ways to get immunity. You're either going to get sick with the disease or you're going to get the vaccine. So as we look at how we're going to get to immunity, getting COVID-19, again, has higher risk of hospitalization and death than the vaccine. There's the risk of long COVID, which I don't think it's talked about enough. It has long-term health impacts for people. Data look like it's about a third of the people who had COVID 6 months later still having fatigue, tiredness, brain fog, shortness of breath. And it's going to have long-term health impacts on the entire United States and the entire world for hopefully not years to come, for quite some time to come. And really the biggest problem with immunity from getting infected is it's inconsistent. We can't predict who has immunity and who doesn't, who's going to really be protected long-term and who's not. Older age is a risk factor for not being protected. There was a study that showed less than 50% had any detectable antibodies of people 65 and older. So older age is definitely a risk for not developing protective immunity. Fewer symptoms, less likely to have a response that's going to protect you. So it's not consistent. We can't look at people and look at PCR tests and say, okay, you're going to be protected and you're not. It's less consistent. Some people are, though, and some people aren't. Vaccination, to go through the immunity from vaccination, definitely safer, less risk of hospitalization and death for sure. There isn't a risk of long COVID from vaccination, so that's great. And the dose, is given to give a consistent response for most individuals. Obviously, those with weakened immune system aren't getting a good response, but in general, that dose is given to ensure that everybody gets a good response. So there's been a lot of talk, and you see a lot of discussion in the news about immunity and what counts. And I fully acknowledge that in the United States right now, immunity from infection only counts for the first 90 days, right? We get 90 days where you're considered immune from previous infection. I think they need to continue to look at that. I continue to advocate to look at that. There's a lot of data that out there that giving one dose of vaccine after an infection is outstanding immunity, and people will be fully protected. So this is still evolving, I do have to say, and we will continue to watch it and bring forward the best information that I can find. So I'm going to close my section with talking a little bit about flu, because it's flu season. October begins flu season. So again, just like COVID, the best way to protect yourself from flu is to get vaccinated. Anybody can get the flu shot at the same time as the COVID-19 vaccine. You can get it anytime before or after. There are no restrictions, and so I've gotten mine, and I think people should be getting their flu shot. One of the things we do worry about is, each year during winter, hospitals surge with flu. I mean, they surge and they get very, very full. This was the concern last year. It didn't bear out. It's a concern again this year. We just don't want to have COVID and flu at the same time surging in hospitals. So, getting our flu shot is a good way to protect ourselves against the flu. All right, I'm going to turn it over to Mary Ann for some more information for the EOC.
Thank you. I'm just going to go through a little bit of information to update you on a few things. First, this is what the current homepage looks like for individuals looking for a vaccine appointment through My Turn. Whether it's an initial appointment, second appointment, booster, you can see there's lots of options. The one thing that I wanted to point out is that a couple of things. The state has made some changes in it to make it more easy to find appointments, particularly through the large pharmacies. So it's easy. It's really very easy to go in and answer the questions, and it'll find desirable, convenient appointments and locations for individuals. The other is that I wanted to point out about the in-home. For those that are maybe medically fragile that need they're homebound and want a vaccine. We just wanted to bring that up again because now with boosters, think that may be important to some members of our community and want to make sure that everyone knows that's still available. You can ask for that appointment through the My Turn system. It gets coordinated with us. To date, not necessarily boosters, but to date, we have administered about 450 doses, so not necessarily individuals, but doses in a homebound setting. And we're staying on top of those. We have 13 scheduled appointments right now, for instance, and I think we have about 8 that have come in that we're in the process of scheduling. So just want to make sure the community knows that's still available, and we don't want that to be a barrier to vaccination. Okay, I'm going to talk a little bit about kind of public health and our role right now, which continues to evolve based on assessment of what the situation is. Vaccination, continues to be really our top priority in terms of trying to end this pandemic. But most of our, most of public health work, we're looking at the population and trying to put into place prevention. We want people not to get sick. But we know that some are, and I do want to say last time I included a lot of information about the monoclonal antibody treatment. And I just wanted to report to you that we have made more progress in working with the local healthcare community. There are more access points. I think we're up to about 8 or 9 now. There is the actual supply of treatment is done through the state, through us on an allocation basis. But we've been able to fill the orders of those that are interested and able to administer. I'm deliberately not going through a list because, as you might recall before, there are different applications, right? For some for mild to moderate, they're already positive with COVID and trying to prevent progression of severe disease that would require hospitalization. There's also a population post-exposure that's used as a prophylaxis, and not all providers are doing both, and I don't want to add more confusion. So it's important that the healthcare community is aware so that they can help direct their patients, and that's really what we're working on. But I want you to know that we have made more progress even since we were here on expanding access, trying to keep those that are COVID positive from progressing to severe disease and hospitalization. So With regard to vaccine clinics, though, what I have before you, I just wanted to update you on what we're doing. More and more, we're relying on the healthcare community. Like Dr. Villa shared before that I think about 60% of all the vaccinations have been done through pharmacies. In the beginning, it was largely public health, but over time, as you would expect, the healthcare community is really providing an awful lot of access. But I did want you to know that we are still doing weekly. We still are doing some mobile pod vaccination events. Often it is with schools, and also with usually it's because a community group is interested and has a niche, population that they want to help. I can give you a couple of examples. The Stanislaus Asian American Community Resource, we've got an event planned, and a Syrian American Civic Club, and others. But that, just so you know, we continue to do that. We also have a fixed site we've been running now for a few months on Paradise Road. It's where our Health Services Agency Paradise Medical Office is. There was some vacant space in that building as a result of some change with CSA, and so we've just leveraged that available space and have made that a fixed public health immunization clinic. And we're running that Tuesday through Saturday. We'll watch and see how that goes in terms of, we weren't sure when that first authorization for boosters, whether there was going to be a large demand. So we just continue to assess, and we'll provide services as the community needs it. We are thinking at this point in terms of the mobile sites, though, and the volumes that we're seeing, that with this very current expanded authorization of boosters and what looks to be in the works in terms of expanding the eligibility to the younger age population, that we'll continue to do this, but probably be phasing out at or shortly before the end of the calendar year, because we don't know that it would really be needed, that there'd be enough volume that would run through. But we just wanted you to know that what we're doing as far as public health, and if the situation changes and demand changes, we will adapt. But that's the kind of the plan on where we are right now. This is just again to make sure that you and the community are aware of the various ways to get to us. We continue to put more information, update information on our website, including links to other. We try not to duplicate, right? Including links to other information from the state or CDC, for instance. And then we continue to we put up a weekly newsletter. Often the content of the newsletter is informed by questions that folks send in, so we invite those questions. That's not the only way to do it. We've got got the public line there, the 558-7535 for the public if they have questions. We want to make sure the public knows if you have questions there are ways to reach out to us. We want to get the information that they need. And that's all we have prepared for you this morning, and we'll stop and answer any questions.
So looking at the vaccine coverage numbers, 50 and over and 65 and over, it's about 70% fully vaccinated. Are we tracking how many of those folks are getting the booster who are eligible for the Pfizer?
No, we're hoping to start doing that. We can't separate third doses that are booster from third doses that are the full dose for someone who has a weak immune system, like post-transplant and cancer chemotherapy. So we can't pull those, we can't separate those, but we can pull out a third dose and try to look at the data. I got some of those data. I think we had about 11,000 third doses given, but I don't have it by age yet. So we're starting to look at that a little bit and try to see what it looks like. And maybe there'll be more demand once Moderna and Johnson & Johnson have that opportunity as well.
And then the federal government gave vaccines to the long-term care facilities originally, and now they're not going to step in. Is that still the case?
That's still the case as far as I'm aware, unless you heard something else. But they all had a pharmacy partnership, so what they did was more like partner them up with a CVS or a Rite Aid who went in the first time anyway. And they are going out again, even though it's not under the federal pharmacy partnership, it's now an agreement between a lot of our long-term care facilities and the pharmacies. So I think they're all covered, and there was a lot of work making sure that there was that relationship, even just because there's some turnover in residents and they wanted to have vaccines available. So as far as I'm aware, those are all being covered by the pharmacies.
And so I guess it comes back to the 50 and over, most vulnerable, 65 and over, the most vulnerable, and then down to 50 and over. We have such good uptake. Trying to get booster shots into all of those folks makes the most sense if we're spending our time and effort, because we have limited resources. And then I would ask, because if you're going to spend time in schools getting 12-year-olds, or you're going to spend time giving a booster to a 65-year-old, I would think that the 65-year-old should be our priority, at least starting out. And so one of the things you had said about the government, and I tried to write your quote down, but you were talking about the state and federal government public health system doing enough to recognize immunity after infection. Can you explain, or what are your thoughts on that?
So I think there's more. I don't know that I see all the data that the CDC and federal government sees, right? I mean, I see what gets published. So, it's hard to track it from looking at our surveillance data, right? We don't do a good job of tracking that because it gets merged into the previous case. It's a system issue. So as we look at protection from reinfection on a population level, it's less than vaccine. The numbers I've seen, it's in the 70%, so it was less than post-vaccination, but not bad for the first perhaps 6 months. And we're still trying to get long-term data. I've seen some out to 11 months, but not a lot of long-term data on that, right? I mean, it wouldn't be more than a year and a half anyway. But when you separate it out, like I said, if you look at people 65 and older, then it dropped down to less than 50%. So I think there's ways to look at it, and maybe they're still parsing it out. I'm not in those conversations, so I can't say. But I do continue to advocate for this to be evaluated, because I think there's some value in recognizing and then perhaps trying to parse out the people that need perhaps some extra help, like people 65 and older. Okay, so let's promote a single dose of vaccination there, because I think there's some good data coming out about that.
Okay. With that, questions for Dr. B?
Thank you, Mr. Chairman. Mary Ann, Dr. B, thank you for your report. It's good to hear the monoclonal antibodies. That program's working great. Are we not receiving any that we order? I mean, are we coming up short at all?
So, no, that's a allocation, because they got in short supply, right? So instead of being able to freely order, they get allocated through us, through the system. We used all of our initial allocations, but now we're not using it all because we just get so much allocated to us. So I think it's not really a short supply. We need more providers providing. So we're still working on that, but everybody can get what they want.
Okay, great. And I'm going to kind of hop around here. Schools, you were talking about vaccine programs being done in the schools. Tell me more about that.
Oh, well, we've made a concerted effort now for months to partner with schools and be sure that we're doing it good geographic coverage. We started out looking at it by we've talked before about the HPI 1 and the HPI 2 to make sure that we were that it was really available, that there was access for all in the community. So the schools have been great to work with. We figure out with them what the availability, first from a facility standpoint. The school districts don't charge us. It's a very collaborative arrangement that they make the facility available and help promote it in their community. It's not limited to school. It's really trying to give access for the whole community. Right. You don't have to have a link to that particular school.
So if an age group of children that were able to get their vaccine, do we make sure that they have parental slips and all this?
Oh, yes. We initially, a parent had to be with the child, and there was some interest in there being a means of parental consent without necessarily having to be physically there. we require that there be an adult there. We have a consent form that a parent can, and it's on our website. It's in English and Spanish on our website, that a parent can give the written consent and designate an adult. We wanted an adult there. So we just, again, trying to remove a barrier, but making sure that that's what the parent wanted.
Okay. In your opinion, boosters, are they here to stay?
Yes. Yes.
Okay, thank you.
Thank you. Other questions?
Thank you, Mary Ann, Dr. V, for the presentation. Just one of the slides on the state vaccination requirement. It seems as though July 1st is probably more likely when everything will be done regarding the FDA approval. One of the bullet points has regulatory process which requires medical and personal belief exemptions. Has there been more data how constrained that's going to be, or is it as simple as if I don't want my child doing it and I personally believe that I don't want them doing it? Is that enough to allow for an exemption?
I have not heard about the process, but that is usually what it was before, right? I mean, that was the process before. You sign a form, you submit it to the school.
Okay, perfect. I'm sure as the time gets closer, there'll be more
Yes.
clarification on that, and we just need to be able to make sure that we get it out to the community so that if someone has a belief, they are at the opportunity. So, thank you.
Supervisor Whitford?
I'm going to go ahead. Thank you,
Okay.
Coach. Thank you so much for your presentation, Dave. Really appreciate you coming, give us the information. I did have some questions regarding our impact medical staff and our medical facilities. We're tracking that data? Do we have any of the numbers specifically regarding our impacted hospitals?
I'm sorry. Could you repeat the question?
Sure. I was wondering, do we have the levels of how our hospitals are being impacted?
Oh, so overall, not just COVID?
Yes.
Yes. They're doing better. They're still very busy. Did you hear something more recent?
Well, we continue to get a daily bed poll that is the COVID information. And
Okay.
like Dr. V said, we don't collect it on the weekends now. It's Monday through Friday. And we continue to have a periodic call when we're in surge. It's weekly. When it seems to let off a bit, we've gone to every 2 weeks with the hospital executive group together. And so that we're in contact and make sure that we're aware of if there are surge issues, if there are issues. And as of right now, it's better. Like Dr. V said, it's still busy.
Yeah.
But it's better. And like when the CEO from Memorial was here, there's concern about the winter because the hospitals typically do get pretty full. So we still want to do everything we can to limit transmission and limit the need for hospitalizations.
And are we seeing a fluctuation of medical staff?
The hospital medical staff?
Yes.
My understanding is that there was a very small percentage that aren't available, but many, over 90%, and I think it varies, but maybe 90 to 95% of the staffing is still available.
Okay.
But we do hear from the hospitals too, and we've reported about even within our public health staff are tired. This is a long effort. It's a long challenge.
Okay. Well, I appreciate it, and thank you so much for communicating with our hospitals and our medical facilities. Thank you.
Thank you guys so much for all you're doing. I know I drive you crazy all the time with these phone calls and stuff, but I know your hearts are in the right place, and you guys are doing all you can to get through this. So I very much appreciate all you're doing, both Mary Ann and Julie, for what you're doing. And just as I know the people here, their hearts are in the right place. We're all trying to get to the same spot. We just have different ideas as to how we should get there, is what it really comes down to. But we all have the good intentions, and we're trying to get through this thing. So I appreciate all you guys are doing. And it was great to hear, and I think you'll probably hear more here today. Unfortunately, I'm not going to be able to stay for the whole thing, but you'll be able to hear the proactive stuff that we're doing. I know when we first got this thing going, nobody knew where it was going or how it worked, but now I know we're at a point where, besides the vaccine push, that we're actually starting to work towards, once people are testing positive, and how do we treat them and how do we keep them out of the hospitals. because that's the ultimate goal here, I guess, is right to keep people from being hospitalized, keep them alive, of course, but to keep them from being hospitalized, keep our hospitals from being overrun. And it sounds like we're starting to work towards, I know initially when people were tested positive, it was, we sent them home, go hide out, and hopefully you don't end up in the hospital. But I know that now we're, and you guys are as much as you can, working towards providing advice, information to help people to whatever type of treatment they should be doing to keep themselves from getting in the hospital with proven things that are out there that, the monoclonal antibodies obviously are the obvious one, but there's other stuff that's out there that can help keep people out of hospitals, and I know that you guys are working towards that now, and I agree that I think that should be our focus. Again, the vaccines, that's great, that's everybody's choice, but to the extent that doesn't happen and somebody does test positive, then we've got to have a regimen. Okay, here's what you do. Don't just go home and hide in your closet. From here, we want you to do these things, and hopefully it will keep you out of the hospital. And I know that you guys are working towards that. And I know that's your ultimate goal. And so I know we're starting to move towards that. And I know it's hard for us as a government body to do that. But it sounds like we're working with physicians. It sounds like we've got 9 places right now in the county that potentially are helping with that. So again, I very much appreciate what you guys are doing. Like I said, I hate to be a thorn in your side, but I love both of you. I know you're doing good work and you're doing all you can, and I appreciate the movement of where we're going now as we move forward with this. So thank you guys for all you're doing.
Thank you much. Any other questions? All right, seeing none, thank you very much for coming in. Okay, now we're going to move on to the public comment portion. I'm going to ask everyone to please limit their comments to 5 minutes or less. I'm going to try and call 2 people up at a time, one that's at the dais, next one ready inside the in this walkway. And I'm trying to think what else. I know that please allow the speakers to speak when they're done. If you feel like clapping, no interruptions or anything. We have a lot of respect around here for the people and listening to what they have to say. Got another one. Okay, so the first speaker I have, first speaker card, and again, you don't have to fill out a speaker card, but please at least give us a first name when you come up so that we can, the clerk can write down something to signify your name. First speaker is Miguel Donoso, followed by Stephen Morrow.
Thank you, Mr. Chairman, members of the Board of Supervisors. I'm come here to make some kind of observation. I'm a member of the Redistrict Commission, and one of the biggest problems that we're facing is the staff how difficult to give to us the information properly to do this decision that we're supposed to do. And I talked already to Mr. Martinez and explained to me what happened to the cancellation of the meeting for just last night. But the issue behind that, to me, is more important than anything else, is the information that we need, accurate information, specifically the census tract and the demographic. He mentioned to me that maybe the next week or 2 weeks is going to be the report of the consultant. But as a member of the commission, we still feel sure in regard to the information that we're supposed to have, the accurate information, specifically the census tract, where the demographics supposed to know where the people live and who are the people in that area, and to not affect the changing. So I abstain to voting because I don't have the information, accurate information. So I'm continuing to act in that way after we have the accurate information and then to make a better decision. And sometimes we feel that the county council sometimes is more like member of the commission when he's supposed to give it to us only technical assistance in regard to the legal issue. So I'm wondering how we can agree or disagree to his participation, to have the input and some kind of directing to the members of the commission to do something that he's not supposed to do or to be in question. So I'm referring to the county council to be more neutral in regard to give it to us only the technical assistant in regard to the law or the employee of his job is county council. Thank you, sir.
Thank you very much. Stephen, oh yeah, please, comment.
Yeah, I'm sorry, Mr. Donoso, I just wanted to provide a couple of quick remarks. First of all, thank you for your service on the Redistricting Commission. It's been a pleasure to sit in those meetings with you for the few that we have had so far. For the rest of the community, I would like to acknowledge just some basic facts and challenges we're dealing with that are going to impact how this process works. Normally, we would receive all of our census data and begin to work on it in April of each year or of a redistricting year. That would give us over 6 months in order to process data, develop the reports and data that you need as a redistricting commission to come up with up to 2 tentative maps and then to bring those recommendations to the Board of Supervisors. In this case, we received our data about 3 weeks ago or so is probably when we got the data and the consultants began to do that work. So that's the challenge that you have. That's what we're facing, and you're experiencing it live in the moment. It is not the desire of county staff to delay any of our meetings. We would really like to keep this process moving. However, it does take time to do this kind of complicated work, and we're going to have to adjust our schedules to deal with that as we progress here. And I just wanted all of you to hear that message. Instead of working on 6 months worth of work, we're compressed down to just a few precious weeks here to get this done. Thank you.
Steve Morrow, followed by Ashley Miguel.
Okay. Thank you, Mr. Chairman, Supervisors, Mr. Hayes, and Mr. Bose. Today I want to comment on Sheriff Dirkse's October 5th presentation on the COVID-related early release of state inmates from the prison system. First, I want to state that I fully support the sheriff and his dedicated employees who serve the county. They already had enough to deal with before the state released these inmates to his care. Now, I want to offer some insights on the rehabilitation process that goes on in the prison system, because I have an acquaintance who is a teacher in the state prison system and was willing to share some experiences. Now, what I'm going to share is hardly a scientific survey, but I think it's going to offer some insight to what's going on. Now, because of confidentiality, no inmate names were ever mentioned to me, and I'm personally not going to mention any of the prisons that this person has worked at. The sheriff stated in his presentation that he got 840 early release inmates due to COVID. Of these, 373 had been reoffended, meaning that 467 had not reoffended or been arrested since as of his presentation. Now, in my acquaintance's classroom, the assigned students break down into 2 main groups. Group A realizes they made mistakes. They want to change, so they study hard. They take extra homework back to their cells, go to professional and peer group counseling, so when they're released, they can be better people and not repeat those same mistakes. The other major group doesn't want to change. They don't care about reform or education. So while they're not breaking any disciplinary rules while they're in the prison system, they're still going to be the same people when they get out, and they're still going to be a problem. Now, you'll find all major ethnic groups represented in both of those large groups that I just stated. Now, you can assume that of the 467 who had not been rearrested since they were released, they probably came from Group A, that bunch that wanted to change. Well, the 373 reoffenders would come from the group that didn't want to change, Group B. Now, of course, we see exceptions on both sides, because this teacher had one graduate from the program who did get paroled and then saw that same inmate back in prison sometime later. So, while the statement that the prison system is not rehabilitating all inmates is true, the process is a lot more complex, because our major issue is to convince those inmates that don't want to change to see the value in reforming their lives. Now, I wish I had a magic solution to that problem, but there's a lot of smart people working for the prison system who've got advanced degrees and certifications, and they haven't been able to solve the problem either. But this matters to all of us, because the majority of inmates will eventually be released back into our communities. The inmates who get sentenced to death or life without parole, they may get the most notoriety, but they're a minority of the prison population. So we can hope and pray that we can find a way to get through to the inmates who don't want to change, because that way they can contribute to society when they get out instead of draining from it. Now, we can all agree that the state should have provided funding to help take care of these early release inmates. So that's up to the supervisors and the staff working with our elected officials at the state level to try to rectify that problem. We're not alone, because there's 57 other sheriffs and boards of supervisors who have to deal with the same problem. Mr. Chairman and supervisors, thank you for the opportunity to speak today.
Thank you, Stephen. Next up, Ashley Miguel, followed by Megan Barajas.
Hi.
Good morning.
Okay, I'm going to revisit the topic of the community education proposal that we presented to you several weeks ago. I would like to emphasize the purpose of this program is to improve the general health and well-being of the community. We realize this is short notice, however, we would like to see this program implemented within the next 4 weeks in order to potentially and positively change the course of any upcoming COVID surge. We realize a major goal is increasing vaccination rates, but to be clear, vaccines do not create healthy people. We need to improve the overall health of our community by encouraging healthy habits, which in turn reduce hospitalizations and death related to COVID. This program we are proposing would be effective for both vaccinated and unvaccinated alike. I have provided you all with an updated brochure. I know I gave you one several weeks ago, but this is an updated brochure. It's also now accessible online, as well as scanning a QR code on your phone, which is inside on the second page so that you can see how it works. We're currently working on having it translated to Spanish as well as Tagalog. We are trying to initiate a partnership with the Stanislaus County Department of Public Health as a means of getting this education information out to our communities. We have developed a plan on how we would like this information distributed, locations in which have the greatest accessibility, and how this public outreach program can be funded. We would like to see this program grow not only from providing educational information, but also to including the distribution of COVID treatment kits throughout the community at the first indication of COVID symptoms, specifically COVID-positive tests. COVID kits have been used internationally with great success and have included vitamin supplements that we listed in our brochure, as well as medications like azithromycin or doxycycline, which are antibiotics, ivermectin, and antihistamines. We realize that ivermectin as a treatment for COVID is a very controversial issue. However, I provided to you Table 2E on the NIH.gov website, which lists ivermectin as an approved or under evaluation medication for the treatment of COVID-19 since July of 2021. Countries such as India, El Salvador, Guatemala, Bolivia, and Peru have been distributing COVID treatment kits with remarkable success in reducing their case and death rates. El Salvador, for example, their cases per million are 6.8 times lower than the United States, and deaths are 3.2 times lower than the United States, as you can see in this graph. The blue being United States and red being El Salvador. This is cases and this is deaths per million. On the next graph, this study represents the fatality rates of patients over 60 among 8 different states in Peru. Note the dramatically decreased case fatality rates among older patients with COVID cases after ivermectin became widely distributed. So the gray is pre-ivermectin and the white is post-ivermectin. An even more telling example is the case counts and fatality rates of 8 states that we listed above compared to the city of Lima, where no ivermectin was widely distributed or used as a treatment during the same time period. This graph compares the lack of significant or sustained reductions in case counts or fatality rates in Lima with the dramatic reductions in both outcomes in the 8 states where ivermectin was widely distributed. So on the other graph, these are the 8 states where ivermectin was distributed, and the red is Lima, where no ivermectin was not distributed at the same time period. Sorry. These are just a few examples of the effectiveness of using ivermectin to treat COVID-19. Although many of these countries are distributing low-cost treatment kits, including ivermectin, for free to its citizens, The use of supplements recommended in our brochure are a great way to start strengthening our immune system. The early treatment supplement kit should not be dependent on the inclusion of ivermectin, although we do feel it plays a valuable part. Peer-reviewed studies have shown early ambulatory treatment reduces hospitalizations by 87.6% and deaths by 74.9%. We are excited to be able to present this early treatment outpatient protocol and supplement recommendation for our community. Peter McCullough said it best when he stated, "Outpatient early treatment makes, of course, considerable sense, not only from a medical but also from an economic perspective. Compared to hospitalizations and even vaccines, this is extremely cheap to implement and would generate a huge savings for the healthcare system and would help safely reopen the economy. Conversely, a continued policy of no early outpatient treatment will not significantly reduce hospitalizations and death. It will further stress our hospitals and healthcare systems, and it will sadly demonstrate the lack of genuine interest in reducing the loss of life and crisis, especially in our most vulnerable populations." Oh, I also have extra brochures if people would like one. Okay.
Thank you.
Thanks.
Next up, Megan Barajas, and then followed by Michelle Manuel. Please note that Supervisor Withrow's left the desk. Okay, thank you.
Good morning.
Morning. Pay no attention. Go.
Okay. I'm a teacher, Megan Barajas, in my 16th year, and I'm a mother of an 8 and 11-year-old. I teach 5th grade at Great Valley Academy, Salida, where my boys also attend. I serve on the school leadership team, and I love every minute of it. I am not here today to debate whether or not anyone should or should not be vaccinated. That's a very personal decision and should be a confidential medical choice we each get to make. I am here on behalf of over 30% of my unvaccinated and vaccinated school staff that hope that their voices can be heard while they are on campus teaching our students. Obviously, I got a substitute for my class today. I'm here to encourage the county to do what they can to protect schools from losing staff like myself and students like my boys in the face of this upcoming mandate. I taught virtually. I taught half of my students online asynchronously while the other half were in my class 6 feet apart. I wear a mask to teach. I remind students to pull their mask over their nose to be worn correctly dozens of times a day. I sanitize their hands on the way in from recess. I submit to weekly PCR tests in order to teach. I complete 10-day independent study lesson plans when students have to stay home on COVID protocol. I am following the rules of this pandemic in the teaching world, but one thing I will not do as a teacher is I will not get a vaccine that I do not want or need. This mandate will be in place to protect individuals from a virus with a less than 1% death rate. This mandate will force teachers like me to decide to get the vaccine, something that I don't want to do, in order to keep their jobs or to quit their job. At our school, we call that bullying. I'm standing against this mandate. This mandate will force parents like me to decide whether they vaccinate their child, pull them from public school to homeschool, or leave the state of California. This decision is already being made by many families, in my own classroom especially. 2 families are leaving the state before the end of the school year to avoid the upcoming mandate pending FDA approval. For these reasons, we need our county, that's you, to take a stance, and I hope that our county can advocate for its citizens and deny this mandate. My responsibility as a citizen in this county, as a mother of 2 and a member of the teaching community, is to make sure I speak up before decisions are made. Thank you for your time and allowing me to be heard.
Thank you. Michelle Manuel, followed by Rebecca Yonan.
Good morning.
Good morning.
My name is Michelle Manuel. and I am a mother of 3 school-age children, and I have one that is getting ready for kindergarten next year at Great Valley Academy in Modesto. I wear many hats as a working mother, and I have a large family. I think 4 is a lot of children, and I participate in our community. And today, as I speak, I'm not really sure which hat I'm wearing. I could be wearing my protective mother hat, my outspoken friend hat, guardian of our rights, free American perhaps. I want to give you some insight before I speak. This is Wesson, that I'm not anti-vaccine, but I am for medical freedom. And I believe that accepting the COVID vaccine mandate in any form will open the door to many more medical choices that members of our state will be coerced to fall under. This COVID vaccine is now on the 3rd booster. I think we heard that they're recommending a 3rd booster for people. At this point, I heard her say, the gal that was giving us the numbers, that 2 is what they're considered fully vaccinated, but for how long, right? We don't know how long they're going to say 2 means fully vaccinated. And by they, I mean the state or the government, the CDC, whoever's making these guidelines. I'm not exactly sure anymore. So at what number, booster, 5, 6, can an individual say, no, thank you? I've had enough. I think I'm good. So at what point can an individual under this mandate take back their medical autonomy? It seems to me that a person should not need an exemption. We should constitutionally be able to decline. Please stand up for our medical freedom and our rights to choose. This COVID vaccine mandate does not allow for individuals that have natural immunity to have a place in the school society. Perhaps instead of allowing this vaccine mandate coercion to take place as a state and country, we should consider a different option, possibly a reform, which I think these are great options. Just as a side note, Weston and I are COVID survivors. We have 4 other members of our household that are COVID survivors. We were wise with our health choices at home, and we recovered with no hospitalizations. We didn't go to the doctor. 3 of the members of our household are considered high risk. So I think I'm grateful that we're part of the 99% that don't need a vaccine, as we have natural immunity now. So thank you for hearing my voice, and I hope you guys will take some kind of reform into consideration versus this mandate.
Thank you. Rebecca Yonan, followed by Joni Grief.
Hi, I'm Rebecca. I've been a nurse for 10 years, and I've been here before. Okay, so a few things. I'm kind of all over the place today. I don't have just one thing I want to say. There's a few things going on. First of all, I know that when someone says they refuse the vaccine, they want to coach and educate, but I'm wondering who is in charge of that. I find it disturbing that anybody that is not a doctor, not a nurse, and not bedside with treating patients that have COVID side effects, why are those people educating and teaching and trying to coerce, which is what I call bullying, like she said, in schools, to teach people and encourage them to get a vaccine? I'm wondering what data that they're using. The last time that Dr. V was showing any data, let's not forget that she was showing her source of information was the Rockefeller Corporation. Okay? I find that disturbing, and so should all of you. One thing that she lied about is that parents can supposedly get religious exemptions from the vaccines. That's not true. That is not true. All the vaccines that are required for childhood they used to be that the parents could get religious exemptions. Not anymore. That passed years ago. I don't know where she's been. So here's another thing. If we're supposed to believe that asymptomatic people are going around infecting and killing people, then why is it so hard to understand that maybe asymptomatic people somehow survived and now have antibodies? And instead of forcing those people to get a vaccine, how about checking if they have antibodies first? When she said, we can't tell by looking at somebody if they have antibodies, has she ever heard of titers? We do this testing all the time, not just for COVID. If somebody says, I don't know when I had hepatitis vaccine, you know what? We're not going to give you another dose. We're going to check your titers. That's what we do. That's science. So once again, as a nurse, I'm here to tell you when the doctor lies, and she lies. Why are they going to schools to vaccinate children? I don't care if their parent is there. That is still considered bullying. Parents do not live under rocks. They know that the vaccine is available. But let's talk about how dangerous it is. Has anybody gone to the CDC website? Has anybody looked at VAERS? I have copies for all of you. According to the CDC, in the past, almost 2 years of COVID now, how many children between the age of 0 to 17 have died from COVID? Does anybody know the answer? 513. 500. We're not talking about hundreds of thousands. In other words, leave the kids alone. They're fine. They will be fine. Is anybody checking them for antibodies first, even before they think about injecting them? No, they're not checking them, and that's not scientific. That's horrible. That's abuse. Anyway, I have all these copies for you guys if you'd like me to approach you or someone else.
Right there with the clerk, and she'll hand them out to us.
Okay, thank you.
Thank you very much. Joni Greek, followed by Carrie Fortin. Carrie Fortin. Hey, good morning.
Hi, I'm Joni, another nurse here, and mama, and she rocks, like everything she said. I would restate it if I could, but I'm going to share my own story here. So the last time I stood before you guys, I was advocating on behalf of our children to oppose the mask mandates. And I know that more than once I have heard from you, Chairman, that this is not the right podium for our pleas. But with all due respect, when it comes to our kids, when it comes to my kids, every podium is the right podium. So my children may not be registered to vote yet. None of our kids are registered to vote yet, but I would argue that they are your most important constituents, by far. So with that, I'm going to read you a statement that I wrote for my school board, and I read to them just last week. I spent an entire year advocating, pleading, begging you all to stand up and do everything in your power to get our oldest students back in the classroom, for their well-being, for their emotional health, for what was in their best interest, which every other state in the nation was proving possible in real time without compromising their community's safety. The only response that was ever afforded to me was that your hands were tied, that it was out of your control, that mandates were law, and law reigned supreme even at the expense of our children. Now I find myself here again, just a mom who feels helpless, begging you to do something for her child. And I get emotional, sorry. I have already unenrolled my two youngest from Sylvan District. I know I am incredibly privileged to have that option. They have adjusted to private education amazingly well, away from all the guidelines. They are safe, they are happy, and experiencing unencumbered learning, which is more than I could have hoped for. I have honored my oldest child's wishes to remain at his school. He has the best friends. He loves his school, his teachers. He would do anything. He would comply with anything to stay there.
No need. You're okay. I'll give you some extra time.
Sorry, thank you. Now, once again, the state is threatening. Sorry. Thanks, girl. Now, once again, the state is threatening to take away in-person education from him unless he complies. I should not have to choose between vaccination or in-person learning. I should not have to file an exemption for him that Senator Richard Pan is already threatening to take away. He's already working on the legislation to take away those exemptions. But it was on KCRA 3, like, please Please do your due diligence and know what's going on here. Please. I should not have to worry about the possible discrimination and segregation that my son will face over this choice. The CDPH and Governor Newsom have gone too far. Public health is not following evidence-based medicine in pursuing this mandate. This is not like other childhood vaccines on the AAP vaccination schedule. It has only been 10 months since the first COVID vaccine was made available to our public via emergency use authorization. So much data has been gathered now over the last 2 years, and the statistics only reinforce what scientists have said to us from the beginning, that COVID is virtually no threat to our young children, and our healthy young children are virtually no threat to our community. That has not changed. Science shows us, it continues to show us that our children are not the primary vectors of this disease. Where are the studies? Where is the concrete data? Make her show it to you. Make her. This mandate is absolutely necessary for our children. This is the only way forward to keep our schools open and operating safely. Is it? I'm begging you once again to stand up for my son, for the thousands of parents in our district like me right now who are scared, who are thinking of leaving California. This is crazy.
We do not comply.
Use your position. I'm asking you again for the second time to use your position, to use your voice. Continue to ask questions. Please. Please continue to ask questions. Ask her questions.
Where is she?
Make the brave choice to say, no, this has gone too far.
Mandates are not laws.
This is in your hands. It's in your hands. I'm begging you. I've been carrying this torch for 2 years. Take it. Take the torch. So, thanks.
Thank you very much. Next up is Carrie Fortune, followed by Janet. Janet's on deck.
Good morning, members of the board.
Morning.
Thank you for the opportunity to speak this morning. My name is Carrie Fortin, and I am a mom of 3 elementary-age school boys and the wife of a frontline healthcare worker. I am here this morning because I am opposed to the vaccine mandate. I am here to ask you to represent your community and the people that reside here. You are our conduit to the government. Our vision statement starts by saying becoming a community of choice. Choice. Giving parents the right to choose what is right for their children. We are being forced into a decision within months that will impact both the education and the health of our children. No government or mandate can cause me to care more about the health of my children. I am standing up here for my parental rights, and I am asking that we work together against this mandate. Thank you.
Thank you very much. Janet, followed by Kent Higgins. Morning.
Good morning. Can you guys hear me?
Yeah.
All right. Well, first and foremost, there's nothing wrong with my eye, so I know you guys are looking at it. Thank you, gentlemen, for listening to these parents. I know there is for sure 2 of you who are very open-minded and listening to them. I know a few of you who are parents, but I want to tell you guys that the ladies to my left, or that were on my left, let me repeat that for you and for everybody behind me. The left, it's the cancer. A few times ago, I've been here multiple times actually. I've been already labeled of races and all kinds of stuff. I've been in this fight for a long time. So it makes me very happy, almost cry to see all these parents being here. I do have family in the schools that you guys or these parents advocate for. I know there's a few of you who are willing to fight for the parents, but I want to beg you to please listen to them. Because of people, these parents crying, these kids at school, I drive by them, they're covered, little faces are covered, little masks have dirt on them, and it's pretty sad. Even my nephews come to me and they tell me, Tia, I don't want to, they cried. So I think at this point, what we need to do as a community, probably stand and get those women replaced. And if they cannot be replaced, because I know you guys have the power to make that happen. Oh, you always smirk all the time. Maybe replace some of you. Yeah. Maybe have some of these parents come forward and sit there. I mean, maybe that's what we need to do. And I'll go there. Maybe put some color in here. You know? Hey, I've asked many times. I wasn't born in this country. I love this country. And for somebody to tell my family has to be vaccinated because a governor who's not even a doctor, because that's her excuse, her data. It's from a governor who's not a doctor. I think his family is not even vaccinated either. They're not. And now let me say, I'll finish with this real quick. According to the CDC, this booster shots she's claiming about, that's just money. Follow the money. If we all just follow the money, we'll get there. Exactly. But there is actually a lot of other side effects that are causing these booster shots. I have family in Mexico. My aunt's in the hospital right now because she took the vaccine. And that is a problem that we're going to have here. That's a problem that nobody talks about. And this lady lies. I was in the hospital early in this year. There's no beds that are full of COVID patients. That's BS. That's BS. I'm sorry, I almost said the word. But that's not true. You guys need to do something to replace her. That is the cancer in this community. And I'm begging you to please listen to these parents, because I know you gentlemen do listen. But there's probably 3 of you who are just like, whatever. Tell us what to do next, doctor. But you do have that power, that authority to listen and replace those 2 women. They are the cancer here. Replace them.
Thank you. Kent Higgins, followed by Madeline Baker. Madeline Baker up next.
I thank you for letting me talk. I was just wondering, before all this happened, when COVID just hit the nation, do you know what the survival rate of people were in general, the percentages? Did you ever hear this? 0 to 19, 99.997%. 20, this is the age groups. 0 to 19, it's if you were up to 19 years old, it was 99.997%. In other words, you didn't get it. 20 to 49 age was 99.98%. 50 to 69% was 99.5%. 70 plus was 94.6%. This was the chances of dying from COVID when we started. Why did we even do all this? It doesn't make sense to me. The vaccines are causing more trouble. Herd immunity would have taken care of this whole thing a long time ago. Other countries are proving this day in and day out. Our country is one of the worst countries going on right now. Also, have you looked at some of the facts that are coming from Israel? Israel is the most vaccinated country in the world, and they have big problems. They transfer the virus. They only last for about 4 or 5 months is what they're coming out with. You guys should really look at what's going on in other countries besides being told by these idiots here. I'm sorry to say. We're listening to they're working for the government, they're on the dole, okay? Let's just get facts straight here. Okay. Doctors reporting adverse effects. Did you get some of this? I'm sure you've heard this before, but 701,559 adverse effects. 60,741 hospitalizations. These are doctors that report what happens, and most of them don't. They say sometimes it's only 1% of the reports, okay? Again, 701,559 1,559 adverse effects, 60,393 urgent cares, 6,637 heart attacks, 5,765 myocardial, I can't even say it, 1,862 miscarriages, 19,210 disabled people, 14,925 deaths. Doctors say this, doctors will tell you this, they say this is a very small fraction of the reports. Reports take too much time and too much red tape, so the reactions are much more. So they're not even reporting what's going on this. Now, here's another thing here. We were told if we took the vaccine, we would not get COVID or would get a less severe case. We have found out this is not true. Now we find out that the COVID vaccines do not prevent you from getting COVID. The COVID vaccines do not prevent you from spreading the COVID to other people. The long-term effects of COVID vaccines are unknown and at this point cannot be known. We do not know that the vaccines are less effective than natural immunity in protecting people, and close to 100 million Americans already have natural immunity. We know in some cases COVID vaccines cause potential fatal heart problems in people that take them. Studies show that teenage boys are 6 times more likely to suffer cardiac damage from the shot than they are to be hospitalized with COVID. The vaccines are far less effective than we were told they were initially. They are potentially dangerous for some and completely unnecessary for millions of others who have had the virus and are now have natural immunity. However, it is mandatory for virtually everyone in America if the vaccine works. How can the vaccinated people pose a threat to the vaccinated? The demands to take the vaccine are irrational, forcing you to accept them without complaints. Here is the science. This is science. Thank you.
Thank you. Madeline Baker, followed by Rhonda Sharp. Sharp is on deck.
Good morning.
Good morning.
I want to first say thank you for your inquisitive questions to Dr. V today. And for those of you that don't know me, my name is Madeline Baker. I'm a mother, I'm a practicing nurse practitioner and educator here in our community, and I'm a concerned citizen of Stanislaus County. I am not anti-vaccine, however, I do not believe that in regard to this pandemic, vaccination is a one-size-fits-all, especially for our pediatric population. On August 19th, 2021, we were told by Dr. Rochelle Walensky, the director of the CDC, and I quote, "The vaccine is starting to wane in its effectiveness against infection. It is holding up against severe disease and hospitalization." Later in this interview, when she was asked if there's data or just hope showing that a booster will be effective in preventing COVID-19, she stated, "There's hope. What we don't have yet is data that shows a booster is effective in preventing infection. But what they can do is prevent severe illness." According to the covid19.ca.gov website, in California, 22.5% of the population is under 18 years of age. This group makes up 0.1% of the total number of deaths in California from COVID-19. 0.1%. The data for this age range in Stanislaus County is not even included on the county dashboard. When we asked why this data was not reported on the dashboard, we were informed by Public Health that since it is such a low incidence in the county, they did not want any minors to be identified. And I respect and understand that. Based on CDC data, among children 5 to less than 12 years of age, there have been approximately 1.8 million confirmed and reported cases of COVID-19. Of those 1.8 million confirmed cases, there have been 143 deaths from COVID in this age range. And this was up through October 14th of this year. As we speak, the FDA is meeting to decide whether or not the COVID-19 vaccine will be approved for those ages 5 to under 12. And I'm not sure if I'm the only one in the room, but I read the 81-page briefing from Pfizer that they're presenting today. And in that briefing, it stated, Pfizer reported that in their study, there were no severe cases of COVID-19 and no cases of multisystem inflammatory syndrome during their study. What we have learned since August is that the vaccine no longer prevents infection, but it can prevent severe disease. However, per Pfizer's own report, there were no cases of severe disease in those ages 5 to less than 12 during their study. In the pediatric population, we need to focus more on their mental health than a virus that statistically is not harming the overwhelming majority of the population. And per the CDC's website, that if our children were to get vaccinated, they still have to be masked in schools. The American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association have recently declared a national emergency in our children's mental health. From January 1st to October 17th of this year, mental health-related ED visits had increased 24% in those ages 5 to 11 and 31% in those ages 12 to 17 compared to that data from 2019. There were 50% more suspected suicide attempts related emergency room visits among girls aged 12 to 17 in early 2021 compared to that in early 2019. We're getting it wrong, and we need to be doing better as individuals and as a community for these children. These children whom a mental health emergency has been declared in this population do not need the added pressure of being told you need to get vaccinated to protect your community. It is not a child's job, it is not their duty, and it is not their obligation to be required to get a vaccine that cannot protect them from a disease to protect someone in our community who's been vaccinated, because their vaccine is supposed to protect them from this disease. And we are putting that on our children. I ask you as board members representing our community to send a letter to our governor opposing the potential K-12 vaccine mandate. Vaccination in this population, again, is not a one-size-fits-all, and it should be a choice between a child's parents or legal guardians under the supervision of their health care provider. Thank you for your time.
Thank you very much. Rhonda Sharp, followed by Sharon Whitlow. Whitlow on deck.
Good morning.
Good morning.
My name is Rhonda Sharp. I was an employee of Stanislaus County Superior Court, and I loved my job. I failed to comply with the mandatory vaccination policy, and on October 8th, I was escorted out of the courthouse. Thank you. I am not an anti-vaxxer. I am someone who believes the choice should be ours. In August, our court was one of 2 courts in the state that implemented a mandatory vaccination policy. This policy was created ahead of any order by the governor or president or before the president's speech about a possible mandate for large companies. A few judges within our court came together and decided what was best for me. The policy provide proof of vaccination in exchange for $500 or request an exemption and be tested once a week. My interpretation: I was given 2 choices in order to keep my job. Number 1, be forced to be vaccinated with a vaccine that we are still learning about. I tested positive for COVID in August, I told the court. That doesn't matter, said the court. You still have to get the vaccination. Or number 2, I could have lied in requesting an exemption. My reason was not based upon a medical condition or a religious belief. My reason was based upon the fact that I believe the choice should be ours and not the government's. I would have held the same position even if I was vaccinated. I don't believe people should be treated this way. I failed to comply. I was escorted out of the courthouse. I was sent home to think about my sins. Yesterday, I was terminated. After I was sent home, I considered in a way that I had never before what was next. Not in regards to the court or my career, but in regard to what was next if we continue to remain silent and not stand up for what we believe in. What next? For those who work at the court who are not vaccinated, what next? Segregate those who haven't from those who have? That has already started. Test twice a week instead of once a week? That change has already been made. The exemption will no longer be good enough and a vaccination will be required. For those outside of the court, what next? We will not be allowed to enter indoor facilities. That's already happening in LA County. Our children will be forced to be vaccinated. We've heard excellent speakers speak about that today. We will not be allowed to leave our house. The police will come to our house and arrest us. What next? We will receive a brand showing that we refuse to comply. For those who are vaccinated, what next? The shot we took wasn't good enough and we have to take a different one. We will have to take boosters. What next? Will we receive a brand showing we have complied? What will be next for all of us after the fear of COVID subsides? What next? Will we be forced to do whatever the government demands? What additional freedoms will we lose? Can you imagine that being forced to do whatever the government tells us to do? 2 years ago, we couldn't imagine that we would be forced to vaccinate. I failed to comply with a policy that a few people imposed. I was escorted out of the courthouse. I asked the public to continue to speak. I thank the board for hearing, and I thank you for allowing me to speak.
Thank you very much. Karen Whitlow, followed by Rosie or Rosalie Cole.
Good morning, gentlemen.
Good morning.
My name is Corinne Whitlow. I guess I'm kind of being known as the Karen in the community, but I'll take it. First of all, I want to just say I'm so proud to be here today, be part of this community, be represented by these board members. I'm actually not going to have to cover quite a bit of my little spiel here because our community is doing an amazing job today covering a lot of topics that I have. So kudos to everybody. First, I'm going to say I'm here to recommend that the board, let me start over. The Stanislaus County board members, I'm asking you to make a recommendation that preserves the public peace, health, and safety here in Stanislaus County. I was here less than 3 months ago on August 10th wondering, where does it stop? I think at this point the answer is obvious. We have numerous orders and guidelines with all the same circular reasoning and focus. These ultimatums given by CDPH and Governor Newsom are short-sighted and are causing hardship within our community. They say these mandates are necessary because of a straining healthcare system. But it is not our children's responsibility to carry that burden. Not to mention, there is a real potential for known and unknown harm that this shot can pose on our children. We need to stop ignoring the problem. We need to focus on healthcare in our community and not the virus. We have allowed this pandemic to cause an escalating mental health crisis, which Maddie spoke to, and according to an article published on the 19th, they have declared a national emergency on children's health. At that point, they also have guided lawmakers to swiftly act. We cannot continue to guide our community in the same direction, which is harming our children. I do not want to live in a community where that is the expectation, or that me and my child have to show a card to enter places. I'm going to take a little bit of time just to kind of cover some of these orders and guidelines that's straight from CDPH, because I think they really speak for themselves, and I don't have to say much about them. So December 21st, 2020, there was COVID-19 preventative care guidelines sent out from the California Department of Public Health and Governor Newsom. Key message, preventative care is most important to maintaining good health for people of all ages. And they go on to talk about what is preventative care. Preventative care includes lifestyle changes, testing, and treatments that detect disease early. Some type of preventative care, like vaccines, can prevent disease. Other type of preventative care, like diabetes or cancer screening, can identify and treat problems before they become serious. And I think really the only thing worth mentioning here is the vaccine. So why is preventative care important? It goes on to. It says preventative care services are important for maintaining everyone's health because they reduce your risk of many illnesses such as heart disease, cancers, and infections. They go on to say, unfortunately, preventative care has decreased during the COVID-19 pandemic. They know there's a problem. A little bit more, we go down to how can I safely get preventative care? Number one thing, telemedicine. I don't know about you guys, but if you're trying to seek preventative care, how is your doctor going to listen to your heart over telemedicine? I think I'll just leave that one there and move on to the next. Actually, I'm glad Dr. V talked about Governor Newsom readdressing this public health order beyond the blueprint because I noticed it was past the date. Unfortunately, there's no changes. So we've identified there's a problem. We tell you to go get your preventative health through telemedicine. We're going to reevaluate this in a year, and we did nothing. We have an all facilities letter here that goes out to the healthcare workers, and this is July 26th of 2021. So basically, this is guidelines for hospitals to follow so they're compliant with the orders. For me, one of the biggest things here is it really puts people's livelihood at risk. You have to make a decision to comply or feed your children. And I wanted to particularly point out, apart from the order August 24th, 2020, guidance on returning to school or work following COVID-19 diagnosis. On page 2, there's a statement that says, return to work or school guidelines for all individuals or in specific settings may differ in certain local jurisdictions in California. Individuals should also consult and follow guidelines from their local health departments. This order is telling us in our county we have power. So a little bit on to what I call the vaccine passport orders. So August 11th, 2021, there's vaccine verification for workers in schools. This is a vaccine passport, you guys. They go on to say why it is so important with our increases of rates. And I kind of made a note here with, in a month and a half, this order doesn't really necessarily seem effective. If you look at our surveillance reports, these things haven't really changed our outbreaks or our infection rates in our community. Whew. Okay, so I'm done with that. Basically, I'm just asking you that you listen to your community. We have some solutions. Just listen to us. We'll come to the table. If we wait for legislation session in January, it's going to be too late, and California will lose their residents. Thank you.
Thank you very much. Rosie Cole, followed by Margaret Ritchie.
Hi, fellas. Okay, I'm a mother, a registered nurse, a concerned citizen of the direction of our community. We've all heard the news that Governor Newsom plans to roll out a COVID-19 vaccine mandate for school-age children ages 5 and up upon FDA approval. With that being said, I've read that our current superintendent is willing to allow parents and pediatricians to decide on vaccination. And I'm greatly appreciative for this for now. As you're aware, some of us are hesitant to have our children be the first generation to receive this vaccine. And in my research of our county for this age group, it does not support the urgency for me to subject my children to receive one at this time. Whether someone is healthy or on the opposite spectrum, immunocompromised, elderly, or with many comorbidities, if you choose to receive the COVID vaccine, it's available to you. I'm perplexed with the fact that we are putting people who have worked through the pandemic in a position of being forced to choose between vaccination or being fired, like my friend Rhonda. Let's be real. Every day the science is changing, and it was initially a vaccine and a booster, and now possibly a third booster in the works. Locally, more organizations are mandating vaccine policies on their employees before any federal mandate has been placed. Why are we allowing this to happen to our community? Some employers are allowing religious exemptions and medical exemptions, but no exception for those who just refuse due to personal choice. And refusals are resulting in people being fired. Who was once revered as essential is essentially being treated like garbage now, and no mercy on how they're going to feed their families or pay their bills. Prior to COVID, as a nurse, hospital staffing has always been an issue. And then fast forward to living through the pandemic, we are now shorter than ever. The working class, we have the uncertainty of the shutdowns, the stress of our children being home more than ever, and being unable to report to work because we have a sniffly nose or a cough. We wear a mask. But the working class pressed on, and we made it despite all of these challenges. But some people are now being told to vaccinate, or they're going to lose their job. While in the process of implementing these mandates, I want you to know that employers are violating HIPAA and forcing unvaccinated staff into certain monitored nasal swab testing areas to check in before work. Subjecting us to everybody in management who it's just wrong. Some employers are posting checkoff sheets and lists of unvaccinated staff in areas where several employees can see. It's workplace discrimination. And sadly, the ugly truth is the vaccinated can still spread COVID. So why are they not subjected to the same testing protocol as the exempted? If someone gets vaccinated, the vaccine serves as a layer of protection for themselves. It does not make anyone immune for spreading or contracting the illness. I guess so. I just want to close with, over the last year, our working class citizens have managed to safely incorporate in society together, in the workplace together, showing up for work, like the gentleman said who owns Modesto Tobacco. We all got through it. But this vaccine mandate deadline is changing that suddenly for people and stripping away their livelihood. I believe it's coercion that violates the rights of people, civil rights of people, and I really don't want our community to turn into Los Angeles County or San Francisco County with vaccination passports and, just ostracizing a population that we should be looking out for. And that's it. Thank you.
Thank you very much. Margaret Ritchie, followed by Jolene Daly.
Thank you, board members. I'm going to remove my mask because
I love that mask.
it can be distracting.
Yes, it can.
My name is Jolene Daly. I was not prepared to speak today. I'm a lifetime resident of Stanislaus County. I appreciate you guys having the willingness to listen to all of these amazing people. I'm proud to be standing with them and taking a stand. I am actually a mental health provider here in Modesto. I have my own practice. I've been working throughout the pandemic over the last 20 months with clients who've faced everything from experiencing $2,000 MID bills to 6 months of not being able to pay rent and not having any idea where it's coming from because of the blatant overreach of government who has no idea what it's like to be a working class individual. There's absolute lack of integrity, transparency, and accountability. And take a stand, Stanislaus, with these amazing women that are here to talk to you today, are standing up to that. And I appreciate you guys listening. I love Stanislaus County. I don't want to have to move out of this area. I don't want to have to move out of California. It seems like everybody's pushing in that direction. And so, like I said, along with Take a Stand, I am taking a stand, and I am no longer going to be idle. I am now a candidate for Congress in our district. I encourage you all to listen to your constituents because there are people like myself who are capable and willing and going to listen, and we are going to take your jobs. Thank you.
So Margaret Ritchie is Margaret Ritchie still here?
She's not willing, she's not letting us speak.
Oh, okay, I'm sorry, no problem. All right, so it's going to be Suzanne Dean, followed by Chris Vieira.
Thank you, Chairman and members of the board. I'm a member of your district, Mr. Condit, and we live in an unincorporated area of Stanislaus County. We've had freedom that we didn't expect to have when all the mandates started coming down. We've been able to move freely and not be required to wear masks everywhere. And now that my husband and I are facing the loss of his job because his job is mandating he be vaccinated, and he has already been informed he will be terminated next week. We decided very early on that we were going to take a stand against this because both of us have had COVID. I'm 10 months out from it, and I just spent 2 weeks ago, I was in Idaho caring for my sister who had COVID, and I didn't get reinfected at all, no symptoms. And I used the protocol that these people, the vitamins, the supplements, I got her those things, and they did help. Early treatment does help, and it is extremely important. You don't have to be one of the mainstream doctors to get advice. I've been listening to many doctors and reading many things that go far beyond my accounting education. I believe I survived because of, I believe it or not, have an active lifestyle. I broke my leg in March, so I've kind of been out of the activity realm. But I eat healthy, I take vitamins, and when this started hitting and started researching what was important for immune support, started taking those things. And then when the idea of a vaccine came along, was open to it, listened to it, but then after I had COVID, I'm like, why on earth would I introduce a substance into my body when I already have the antibodies to fight it? So it just doesn't make sense. We also have grandchildren that are in that 5 to 11 range, and we have decided as a family that those children will not get that vaccine, that we will homeschool them and start working with other people to homeschool children. And both my husband and I are college educated, and we're quite capable. We have a teacher in our family who can write lessons plans for us. And we're ready for that because we're not going to allow our children to be given a substance that could potentially harm them. And there are no long-term studies to tell us that it won't. So this rush to give it to our children is just obscene. I also saw a story this morning out of Sweden that says they have banned or halted the Moderna vaccine for anyone under 30 indefinitely because it does cause myocarditis, especially in young men. And that is heart inflammation that can permanently damage you. So I believe that what I'm hearing here is there is some support from you to not have vaccine mandates in this county, and I would hope and pray that you continue to hold that line. It's not something that we as Stanislaus County residents are willing and able to bend to, and I support anybody's decision who wants to take the vaccine. That's your choice, but my choice is no.
Chris Vieira, followed by Jim Bishop. Thanks for leading us in the pledge today, too. Appreciate it.
Thanks for having me. First of all, Mr. Chairman, Supervisors, most of you know who I am, but for the public, my name is Chris Vieira. For the past 10 years, I served as the mayor for the city of Ceres. As the board probably knows here, I usually don't come up and speak unless there's something that I feel very strongly about. And before I get into that topic, I did want to just implore the board to ask some questions of Dr. V. Again, for the public's edification, I had the opportunity when COVID first started to sit in on daily calls with Dr. V and others to get updates on what was going on and what the state was doing. So I always questioned where things were going. And one of the questions I have on the slide that she had here, and I wish she was still here, was there was a specific percentage. Like, for instance, people 50 years of age were 67.8% had been vaccinated, and I think that the higher classification next was 70.5. As an engineer, that's a pretty specific number. So my question is where did that data come from? Well, obviously, you would have to take every resident in Stanislaus County, have their name, have their age, and also have all the data from hospitals, pharmacies, and everything to determine a specific number to one significant digit. So my question would be, where did the data come from, and why are we collecting that? what are we going to do with that data if the vaccinations are available for everybody? Why do we need percentages? But anyway, that's not why I'm here. That would just be a question that I would ask. The reason that I'm here this morning is to talk about mandatory vaccine passports. Now, we all have opinions, and I think we've heard widely as to pros and cons of the vaccination. I'm not supportive of them, but I'm not here to talk about that. I believe everything is about individual choice. And to that end, I was recently brought to my attention that the San Joaquin County Board of Supervisors on October 12th, on a 4-0 vote, adopted a resolution prohibiting the use of mandatory vaccine passports in any San Joaquin County office, board, agent, or private business. They believe that it is an individual's personal choice, as do I, and that it is not something that a government entity, and by the way, as far as the public knows, we are the government. They sit here because we put them there, just like you put me there. So why I'm here is I would like to urge one of you to bring this forth in one of your upcoming meetings and see where it goes. I will tell you a couple of things that people don't really think about. When you do your research and you do the data and you look at everything, the class or demographics in the United States that has the lowest vaccination rate is the people of color. So if we as a county, because the state requires us to put a mandatory vaccine passport in place, we have now discriminated against a classification of people that we say we aren't going to discriminate against. And rightfully so, the people of color have many reasons why they don't want to get vaccinated. This country has treated them pretty harshly over hundreds of years. So I don't believe in discrimination. And another point that I want to make is the vaccine, by telling somebody that you have to mandatorily have a vaccination, you are in essence saying that they are immune deficient. We can all agree on that. Well, there's another classification that is immune deficient, and that's AIDS patients, and we cannot discriminate against those. So I will leave copies of the resolution that San Joaquin County passed, and I would ask that you please take this up. I'm also going to be approaching Merced County. Again, this isn't about whether people believe in the vaccination or not. You still can do that. I just don't think it's government's right to mandate it for individuals.
Thank you very much. Next up is Jim Bishop, followed by Jacko Kalashko. Jim Bishop. How about I'll call on him again at the end. Jacko Kalashko, followed by Megan Short.
Good morning, gentlemen. Sorry, Mr. Chairman, I didn't quite hear my name correctly.
Uh-oh.
My name is Jake Kleochko, resident of Modesto, father of 7 children who I homeschool, and married to a nurse who works locally. And in my past life, I had worked in media, in government, and in education. And I'm not here to accuse anybody of anything, but to render an observation. And that observation is simple. That is, ever since COVID erupted in this country, as a media practitioner, I have observed one thing, and that is media and government have not given us the truth, have not presented to us both sides of the issue of COVID. And while I don't mean to lecture you about doing your job, there is one fundamental fact about governance, and that is the overarching role of government is to promote and pursue the common good. That is the number one work of governance. It is to promote and pursue the common good. But good is premised on truth. There is no good if there is no truth. As Aristotle tells us in the Republic, truth and good are synonymous, transcendentals. And where there is no truth, then there is no good. We're not pursuing good when we are not pursuing truth. But the only way we can obtain truth is when we have factual information. If there's no factual information, there's no truth, there's no freedom when there's no factual information. The question to ask is, why is it that it is this public who is telling the government the truth? When it is supposed to be the role of government to inform us about the truth. Why has it taken 18 months for the public to present the truth to government? There is something amiss here, gentlemen. There is something amiss here. It's either government is not doing its role, or they are a bunch of tyrants who are not telling us the truth and are therefore not governing properly, according to the oath that they have sworn. You see, these gray hairs have served 2 presidents and 4 mayors. I think I know what governance is all about. I fled a country of a tyrant because I was not allowed to tell the truth and to advise my presidents and mayors I worked with to do the right thing. And I'm here in America now, raising my 7 children, who I did not put through school, because as a former academician, I know what filth goes on in schools. I have chosen to homeschool my children because I want them to grow up in the atmosphere of truth, of freedom, in the pursuit of common good. Gentlemen, you have a sacred duty to uphold and protect. I challenge you, gentlemen, to tell the truth. Why is it that it has to take this public to awaken government about the truth? What we are presenting to you here is not something exclusive to us. It's all open. It's available for everybody. It's only a question of doing your due diligence to find out the truth and not depend on what the CDC is pushing, on what the FDA is trying to push, on what big government is trying to ram down our throats. As I said, I'm not here to lecture you, gentlemen. I'm here to plead with you. I'm here to ask you, as the representatives of the people, please do your due diligence. You can discover the truth. We need balance. I worked in media, and what do we see in media? There's a lack of balance in media. You don't get the 2 sides. Facebook keeps shutting us down, right? And you don't get the same truth in mainstream media. But we can discover the truth. If you need our help, by the way, if you need our help, we're all here. We'll tell you everything about it. Okay? Thank you very much for your time.
Thank you very much. Megan Short, followed by David Teague.
Are we ready? Hello.
Hi.
I did not plan on speaking today, so bear with me. My name is Megan Short. I am a mother of 4. I'm a small business owner, the same small business that was told that I was not essential to provide for my family last year. But, you know, I'm up here because I'm listening to everything that they're saying, and she's saying, well, we don't have the data. Well, I'm going to tell you my story. I had COVID. Me and my whole family had COVID last July. I was 7 months pregnant. It was extremely, extremely minor for all of us. So when the antibody test came out, I was like, I'm going to go get a titers test. Just had a titers test last month. 1.6 was my levels. 1.00 shows antibodies. 1.5 is considered high. I'm 1.6. I'm not the exception to the rule. Okay? So I hope that, like he said, I hope that we can follow in San Joaquin County and shut this all down. Because here's the thing, if we allow this to pass, what's going to come next? And if we're only doing vaccination, like there's people like me and lots of other people that are out in the community that have antibodies, that are not out spreading it. So that's all I wanted to share really today. Please, the vaccine passports, like if we allow this, we are no longer free. And me, along with probably everybody else that's in this room, I mean, we all know if we allow this, if you guys do not stand up for us, this is going to go at a state level. They're going to push these vaccines through legislation. It's going to be on the school schedule. Like, we need everybody. All of you we have a voice from this side. You guys have a voice on the internal side. We need you guys to stand up for all of us, for our kids, for our jobs, for everything. It's not right what's going on here. But thank you guys. I appreciate your time.
Thank you, Megan. David Teague.
I also wasn't planning on speaking today, but listening to everybody else, I couldn't say anything any better than anyone else could, and I'm so proud of everybody that's in this room today. I'm so proud of the healthcare workers, of which I am also a frontline healthcare worker, speaking up and saying, we don't comply. We the people will not go through with this. If you go through with this, you're going through with another version of slavery. We're not going to enact slavery in our community again. We're not going to abuse our children. I don't comply. That's it.
Thank you very much. So that is the last speaker card. Actually, I'm going to call Jim Bishop, or not Jim, Jim Bishop. Did he leave? Okay, last speaker card I have. Anyone else that wants to speak, come on up, state your name for the record. Let's let the other folks go first. That's perfect. Just line up right there in the... Good morning.
Good morning. My name is Melissa Kelly, and I was born here in Modesto. I moved away a long time ago and swore that I never would come back. But now that I am, it has taken me a long time to realize what the true potential is and why I am back here. And I've grown to love this community again that I once stated that I didn't care for so much. I am here today to speak in favor of adopting an official ban on vaccine passports. I appreciate the statements that were made early on by Mr. Hayes that you stated that there is no plan to implement anything like this. But I would like to point out also that within 10 minutes of you stating that we were given a slideshow that stated that there would be mandates for school children. So I'm wondering if you consider school to be a public access item. You stated that, there would be no prevention of any public service to anyone who chose not to get the vaccine. So I see a huge contradiction right there. It's pretty obvious, and I just felt that it would be remiss if I didn't point out that kids are being told they can't go to school if they don't get the vaccine. So I appreciate the statement, but it needs to go further than that. We need a solid commitment from you, from each and every one of you, that you're going to be with the people, that you're not going to discriminate against anyone for not taking an experimental health procedure. And it may be approved by the FDA, and when it gets approved by the FDA, it will still be experimental. The clinical trials do not end until 2022. So how does that make any sense? How are you going to prevent discrimination from happening? That's what we want to know.
Thank you. Morning.
Gentlemen. My name is Molly Lewis. I am a mom of 3, and I'm a professional in the community here as well. I've been coming to these meetings for the last couple of months, and I just want to say thank you all. I know that your position is not one that many people envy, between trying to manage the demands of the people and also the demands of the state and trying to follow the science. I don't envy your position at all, but I do appreciate you letting us come and have a voice. One thing that's been really glaring at me, I've been checking the data on the county website. I'm listening to Dr. V. We know it's glaringly obvious that there are people who are vaccinated that are contracting and spreading COVID. I had COVID last January. My family had COVID. We don't wear masks. We're not vaccinated. We take our vitamins. And I'm the crazy person in my family that believes in my immunity, in my immune system, and, fresh air. So when school started, my youngest was going into 5th grade. I actually pulled him. I withdrew him from the school district. He's homeschooled right now. He's rocking it. I'm not afraid to pull my other 2 out of school. I gave them that choice to go and continue their in-person education. However, if this vaccine mandate comes down, there is not a chance that I will keep them in public school. I will do whatever I can. I will fight tooth and nail to get them either a private education or a homeschool education, because this is not going to be happening. But my question to you guys, thank you for asking Dr. V those questions today. Why is there no data, month after month, day after day? Why is there no data showing those cases that are positive, how many of them are vaccinated? Because if we're all immune, we have natural immunity, and that 90-day comment she made is a bunch of crap. We all know I had COVID last July. I'm still fine. I still have antibodies. How come nobody's asking her how many of those positive cases are people who are vaccinated? Because I know just in my circle, handfuls of people every single week are testing positive for COVID, and they're already fully vaccinated. So where's the data on that? You guys need to be asking these questions, because those cases are inflating. They're having us mask indoors now. That's a load of crap. They're having us mask our kids. Now we're going to be forced to mandate to continue working or to send our kids to in-person education. Those are questions that we need the answers to. You can't just show certain data without the right sources and then say, oh, well, there's this hole in the data. Find the hole, figure out what that is, because I guarantee the positive cases are being spread by the people who are fully vaccinated. Okay? So again, I thank you for your time. I'm not afraid to pull my kids. I'm not afraid to move. I will do whatever I have to maintain my freedom as a citizen of the United States, and I pray that you will do the right thing in taking away this mandate, especially for our kids. It's not going to happen. We won't comply. So thank you.
Thanks, Molly.
Hi, I'm Adele Quisenberry. I'm a grandmother of 4, 3 in grammar school and 1 in junior high.
Could you pull that
I've
mic
loved everything that everybody has said.
Could you pull the microphone a little closer?
Oh, I'm
to
sorry.
your mouth?
I've loved everything that everybody said. I took the words out of my mouth that I've been saying for probably months on end, so I don't want to be redundant. I just think it begs the question to the board, if you're listening and you're seeing what's going on and the truth of all this data, then it begs the question, what is it that would keep you from not standing with the people? What is it? Are you getting some sort of incentives from our state, from where, that you want to hold on to this mandate situation that people should have clearly a choice? I'm not anti-vaccine. You want to get a vaccine, get it. You want to wear a mask. But it's fearful to know, at the last meeting I came to, where it was about the masking of the kids, my fear was that you were just giving lip service and not really standing for the people. And again, it fell apart and the kids have to be masked. I have a grandson that was chastised at school for not wearing his mask correctly. The teacher said, put your mask up. You're a danger to others. To a 10-year-old, a teacher is doing that. I find that so disturbing. And so I had to ask him what he thought about that, because some children, it would be so scary that they would think they would literally be hurting somebody. Fortunately, I've been instructing the children what masks are all about. There's no scientific proof that they actually work. And then they're being put in a position, it's so disturbing. The other thing I wanted to piggyback on was the first speaker you had a lot of great information on as far as all the data goes and the treatment of oxychloroquine in early cases of COVID, which should have been done long, long ago. And I think there's other doctors that you actually need to listen to. If anybody got an opportunity to listen to Dr. Harvey Risch, let me tell you a little bit about him if you don't know, and you should look him up because Dr. Risch obtained a PhD in mathematical modeling of infectious epidemics and has actively published on that challenging topic. He is professor of epidemiology at the Yale School of Public Health, widely recognized as one of the premier public health institutions in the country, and has published over 350 peer-reviewed scientific research papers. His publications have generated over 41,000 citations of those papers in the medical and scientific lecture. He has been the one that's been at the forefront of studying oxychloroquine and the early treatment of it. He specifically spoke the other night on TV about the vaccines for children because that's at the forefront of our minds. He brought out that from January 2020 to the present time, fewer than 450 children have died from the virus between the ages of 5 and 18. And half of those children died with COVID, not of COVID. And the statistics are about the same or smaller of those who died of the flu. His suggestion to the parents, because he was asked, if you had a child in this age, would you vaccinate your child? And hopefully you look this up and see his conversation. It said this vaccine is not a high-risk vaccine, but it's high-risk that every child that would be vaccinated wouldn't die, but perhaps some could. But the risk is high enough that a benefit to homeschool the children outweigh the benefit of the vaccine. The risk of the vaccine is greater than the virus for children between the ages of 5 and 18. So he suggested there's no need to vaccine your children. I fear for these parents and for my daughter and her children, and I would stand with the parents to make a mass exodus from school if this mandate stays. Mass exodus. Parents get together, make a homeschool co-op. I have information where we can get the curriculum and stay away unless all of you could stand with the people. So I hope that you're listening. I hope this is not falling on deaf ears, that this is something that is so disturbing. But thank you for your time.
Thank you very much.
Good morning.
Morning.
My name is Debbie. I wasn't planning on speaking directly either, and I guess I'm going to sum things up, but I definitely want to thank everyone for listening. I think that's the first step, and for everyone speaking up. I'm speaking up for myself. I'm speaking up for families who are insecure in coming up. I'm speaking for those that don't speak English very well, who come and ask me what to do. I'm speaking for the children at school who see us out there with our little signs and we greet every morning. And I'm just speaking for my own child who spoke last week at a district meeting, who's 11 years old and has her own mind and is against anybody telling her what to do, because she said, this is America, Mom, and this is what I need to do. And I promote that. Just in summation, everything that's been said, I'm just going to wrap it up. The age group of our children that we're looking at for these vaccine mandates is a 99.99 something recovery rate. from this illness. The average death age for COVID is well above the average life expectancy. This is not an FDA-approved vaccine. It's an emergency status vaccine. The vaccine that has been issued under approval is not the one that's being received. You know, I've had to learn myself to start digging and looking for information. Now we're on the money trail, finding out where all the money is coming from and going to and wondering where it's at. But we have to do that. We have to be uncomfortable. We have to start asking questions. I appreciate you asking questions. I appreciate you having an open ear. Boosters. We talked about boosters. So if they're talking about these vaccines and the boosters, I don't know, we're on 2 or 3. Do what you want to do. It's fine. I'm fine with vaccinations. I've had vaccinations. We need to pull the brakes on this one. This is not a real vaccine at this point. This is not even a flu shot at this point. I don't go in for boosters for my flu shots. Who is legally responsible if there are any issues? We keep asking this and nobody wants to take the blame. Just come and get your shots and nobody wants to be accountable. If jobs are telling you to do it, you know, that's technically, if we look at the Civil Rights Act, I believe it's Title VII, Title VI as well. We need to revisit that. We need to look at that. This is discrimination. OSHA. OSHA is not even enforcing recording requirements for employers to record worker side effects from the mandated vaccines that the employers are asking, at least through May 2022. So if OSHA, who's supposed to have this stuff happening and documented, is not even asking or won't even document, why are we not asking why? This is concerning. The COVID response since the beginning has been determined to be psychologically damaging to our children. We know this as well as ourselves. You know, they had no school. We stayed home. We wore the masks. We wear the masks. My mother is a stage 4 cancer. She was a survivor at this point. You know, we're counting the days. And we have to pick and choose our battles. My child comes home from school. It makes her feel good. Take her clothes off. She showers. She's cleaned before she goes and sees Grandma. We stayed home. We did all the right things we're supposed to do. We waited at the driveway. We came into the home. We stayed away. We did distance learning. My child had 3 teachers last year. We were lucky enough to stay with a teacher at the end when our teacher couldn't teach her, and they had to be separated out and go into a new class. We were able to stay within our school with a distance learning teacher, where other students had to go somewhere else with a school teacher. They had no idea who they were, new classmates. You know, all these are challenges, and everyone's stepping up and doing their part. We, again, are asking you to help do your part for us, help be that extended voice for us. Testing, why aren't there other options for testing? You either get tested with a swab, you don't offer a spit test, or you stay home. Our children deserve an equal in-person education. The option of independent learning provided is not enough. Please look for other options, which include inclusion and equality for all children. We understand that there are financial incentives for the schools complying with mandates and regulations. Please take in consideration these. Please look at them. We are not numbers. In closing, just please remember that the moment we give up our freedoms and the right to choose is the moment we give up all of our liberties. I am showing my child I didn't stay silent. I'm showing our neighbors I didn't stay silent. We have to stand up, and you must stand up for everyone as well. Thank you.
Good morning, gentlemen, or afternoon. I shouldn't probably get up here and speak, but I just want to say I was born in Stanislaus County, I've raised my kids here, I've homeschooled, I've worked, and a word I want to say today is freedom. And I don't hear that enough, and I think our duty as a citizen of the United States of America is to vote, to pay your taxes, obey your laws, and the government has no right to come into my home, to these people's home, or to tell us what to do with our children or our babies. And I thank you for being here. It's a lot to put up with the citizens of the United States, because we all have the right to say whatever we want. And I know you guys have taken a lot of probably non-positive statements against you, but I think freedom is the most important thing to everyone in this country, and stop them from taking our freedoms. Thank you.
Thank you very much. Hey, I'm sorry, could I get your name?
Sherry Bohr.
Sherry Bohr. Very good.
Hey, I just wanna-
Hold on a second. Anyone else to come up here and speak? Okay, come on up. First time?
I just want to clarify, when I had COVID, it was of July 2020, so it was 15 months ago.
Okay. Good morning.
Good morning. Thank you for this opportunity. I am a registered respiratory therapist in the state of California. Been on the front line since the beginning of COVID. I personally believe that there's way too much money involved with big pharma. There's a lot of money. People are being paid off. There's a section that I think preventative medicine is not being used. I see people coming in the hospital with COVID. I work with ventilators. I work with sick people. I personally have a prescription from my doctor for hydroxychloroquine, because whenever I feel like I'm getting a tickle in my throat and I feel like I might be getting sick, I take it and it's gone, like the next day. We're not looking at preventative medicine at all. People should be getting preventative medicine when they first start getting sick, because it goes into a pneumonia, it goes into your lungs, okay? And people can be treated before they even get to the point where they get short of breath, they need to be put on oxygen. So there's a lot of variables here, okay? The kids should not have to be vaccinated. We don't have any long-term statistics on what's going on with this. The CDC, it's not been approved. The FDA hasn't been approved. All I know is that I feel like I'm living in the twilight zone, because I think people can be treated before they even get to the hospital. All right? I hate to be I work with COVID patients all the time, and I don't want to see them come into the hospital. I truly believe this is being handled all incorrectly. My job was threatened. I thought they were going to let me go, but what happened was there were so many people in the science field who are frontline workers who were not getting vaccinated, that if they let us all go, they wouldn't have staff, basically. Okay? So there's a lot of information, just like these other people were saying, that is not being given to us through our media, we're just not being told the truth. And I do, like I said, I feel like I'm living in the twilight zone, because I know these patients that I'm helping to treat on ventilators, BiPAPs, all the equipment that we have would not have to be admitted and be put on those machines if they were treated as right when they start with the symptoms. So we need to totally revamp this whole thing and back up a bit, okay? I've got hydroxychloroquine, it works for me, and I think that it was totally, Big Pharma doesn't like it. Do you imagine the amount of money these people are getting? And every vaccine that comes out is another $500 million for a booster shot they're getting. Okay, so we are way out of, things are crazy out there, okay? And I am just really glad that I still have my job, that I can, because it's Hippocratic oath that my patients come first. I'm there for them. And I'm so glad that they are letting frontline workers still work, because we're understaffed. We're understaffed with nurses, we're understaffed with respiratory therapists, we're understaffed. And it's not because the COVID rates are really high right now, but it would really have been bad if they would have let us go. So I thank the Lord that I'm still there helping patients. Thank you for your time.
Thank you. Hey, good morning.
Hello, my name is Ginger Parrish. I'm another nurse here in the town. Personally, after listening to everyone, I just like things to be a little bit more clear, because it seems like the community seems very concerned with the children and the schools and vaccinations. But just like to reiterate, we are still using the emergency use authorization, quote-unquote, vaccines at this point in time. The only one that was FDA approved is called Comirnaty, and it's not available. We do not have it. It is not being used, and it was approved for age 16 and over. Yet today, it looks like they're maybe talking about or discussing or seeing the case from Pfizer and what they're presenting to determine if they can vaccinate ages 5 to 12. I don't think so. We don't have it. It's not available. The information here, again, everyone is sitting here telling you it's a bit skewed and it's a little bit off, and that there's a lot of concern. Personally, I'm really upset to hear about everyone losing their jobs. This is our community. This is where we work and where we live, and so many people are losing their jobs. I also hear the community asking you guys to maybe make a vote or come to some sort of determination, a little bit more like San Joaquin County. And I see that everyone is so nervous and so scared and so apprehensive. And if they got you guys to kind of do that, I think it would set the community a bit more at ease. So that's all I have to say. I think that's what I'm getting out of today, is hearing everyone's asking about you guys. If you could please have some talks and see if you guys can come to a vote to help protect and represent your community. Thank you.
Thank you, Ginger. Okay, last call for public comment, first time through. Anyone else? Seeing nothing, one of Rebecca, keep it short and to the point, because I'm not opening back up for folks.
I will. So I remember back in August when we were here, there were a lot of my fellow nurses that had legitimate medical issues, either for themselves or their loved ones, and they were asking their local doctors here for medical exemptions. Their doctors told them they are not allowed to sign medical exemptions. So among the millions of things people are asking you guys to do, I'm asking you to do one more thing. Can you please look into that? Can you please look into who's bullying the doctors of our community? Who's tying their hands? Who's limiting them from being honest? Because I don't see any doctors out here. It's the nurses, and I've always told you the nurses will tell you the truth. Somebody is bullying our doctors. Please look into that, because that affects everybody here.
Thank you very much.
Thank you.
Megan, did you want to clarify now? Megan, short? Oh, Matt. No, I thought it was.
It's
I'm
When
sorry.
my mom back there is telling me. A lot of people have asked, I got in
Just
trouble
address
last time,
this,
I'm sorry.
yeah.
A lot of people have asked, have said, our doctors are getting bullied, and who is making those regulations. And so as an advanced practice provider, I can give, from the state of California, I'm allowed to give 5 medical exemptions per year. However, those exemptions have to align with the recommendations from the AMA, or the American Medical Association, the ACIP, which is the governing body that advises Dr. Rochelle Walensky of the CDC, as well as the CDC. So if their recommendations are not followed, as a provider, you can lose your license. So it is not necessarily someone saying you cannot do this, but if it does not align with those 3 bodies, then you have potential repercussions.
Thank you very much.
Thank you.
All right, so now I'm going to close the public comment section. Any comments from any board members? Okay, thank you all for coming in. This is probably one of our longest public comments. My closed session reminder just popped up, my 15-minute reminder for closed session. So we're going to go ahead and take a 5-minute recess, if that's okay, so we can use the bathroom really quick. Thank you all for coming in. Okay. Come back into session. Moving on to item 6, which will be the consent calendar. Would any member like to pull any items? I'm going to pull B8 really quick just for comment, for nothing more than comment. Anything else? Seeing nothing, anyone in the audience want to comment on any of the consent calendar items? Seeing none, I'll just bring it back. B8 is an agreement with the Deputy Sheriff's Association. And so now we have 12 bargaining units in Stanislaus County and 1 unrepresented. And we are in contract with the unrepresented and 11 of the 12, which I'm very proud about. It takes a long time to do negotiations. This one was not any more contentious than any other one, but it's always nice to see. And I think we have an agreement because I'm tired of listening to the sheriff. Always advocating on their behalf. So again, a great thing. These are the custodial deputies working inside, and there's reasons why, because we have lieutenants or a shared group, and it's always makes it a little more complicated just in trying to get to an agreement. So good things happening there, and I want to thank the sheriff for helping get us through that. So with that, any other comments? Okay, I'm going to bring you back for the consent calendar on all items. We have a motion?
I'll make the motion.
A motion?
Second.
We have a second. All those in favor say aye.
Aye. Aye.
Opposed? Motion carries 5-0. Thank you. I will lick my finger. Okay, going to move on to public hearing. Discussion item. Approval to enter into agreement with Stanislaus Equity Partners, Inc., a 501c3 nonprofit to provide services that to disproportionately affected communities in Stanislaus County in the amount not to exceed $5 million. Jody and Tina will be presenting.
And I'm just doing a very quick introduction of our Deputy Executive Officer, Tina Rocha, who's done the lion's share of the work here, and also recognize our partners from Stanislaus Equity Partners are here with us this morning, as well as City Ministry Networks and our key business partners in putting together this Community Development Corporation. I will have 1 or 2 things to say probably before we're done, but I'm going to go ahead and ask Tina to go through the slide presentation. Thank you.
Good morning. I think it's afternoon now, or almost.
Good morning, Tina.
On the cusp there. Hi there. So good morning, Chairperson Hughes, the board members, CEO Hayes, and County Council Bowes. This is actually, I say, a pretty timely presentation given the comments we heard from the Central Valley Association of Realtors earlier today. So just to quickly go through some background, you've seen this before, but in 2018, the Stanislaus Community Foundation had contracted to have a study done. Among those findings, it found that there were 2 unique organizations missing from our local landscape. One is a community development corporation, and the other is a community development financial institution. And so today's presentation is going to be focused on the community development corporation. So just to quickly go over what is a community development corporation, it's a 501c3 nonprofit organization. It's created to support and revitalize communities, especially those that are impoverished or struggling. And they often deal with the development of affordable housing and a wide range of community services. So locally, the development of the CDC, as I just mentioned earlier, started when the Stanislaus Community Foundation had commissioned that study in 2018. Since then, there were several steps taken. City Ministry Network was approached and asked to explore to form a local CDC. Community Ministry Network then approached the South Modesto Partnership, which was already an existing entity, and in November of 2020, the South Modesto Partnership Board voted to transition into a CDC, and then that work had concluded in July of this year, and that now that entity is now known as the Stanislaus Equity Partners, Inc. As we shared before, Stanislaus Equity Partners, Inc., or STEP, as I'm going to refer to it, has 2 core initiatives, one being Pathways to Home Ownership, and the second one is Economic and Resource Development. So on the funding side of this, in March of 2021, the American Rescue Plan Act was approved. There was $107 million allocated to Stanislaus County. And then in May of this year, we were before you with investment opportunities for those funds. And one of those opportunities was $5 million in STEP. You as the board supported that, and that also gave direction to go and negotiate a contract and then return back to the board, and that's why we're here today. First, I do want to thank County Council Bose and Deputy County Council Lori Sickard. Lori was instrumental in getting this agreement through. It is the first agreement that we have that is using ARPA funds. And there was a lot of rules and regulations to navigate, and just really want to give a shout out to her. We would not be here today without her diligence and getting this together for us. So in the terms of the agreement, there are 5 main objectives for STEP. The first one is to facilitate development of housing units. Those could be accessory dwelling units, tiny home villages, transitional housing, just a variety of types of housing units. The second one is to identify available properties and lots to maximize any current land use and facilitate the construction of cost-effective housing projects. The third objective is to connect low and moderate income households and other disproportionately impacted community members to resources to assist with housing options. The fourth is to catalyze partners and provide financial literacy, education services, and a variety of ways to empower families to improve their financial health and accumulate wealth. And then the fifth objective is to provide economic and development services to individuals and businesses, giving them advice on accessing capital, resources, and technical assistance. So what you're seeing before you is an example of one of the objectives with the target goal, proposed activity, and measurable outcomes. So for this example, the objective is the number one, first one I mentioned, which is to facilitate the development of innovative and cost-effective housing projects. The goal would be to create 2 prototypes within 24 months, and those could be accessory dwelling units or tiny home villages. The proposed activity would be to prototype scalable housing options and promote the creation of additional units. And then we have 4 measurable outcomes for this particular activity. It would increase the affordable housing options. It would create a replicable model to increase more housing options. It would increase the number of Latinx, minority-owned homeowners in Stanislaus County, and then it would also increase the economic mobility among disproportionately impacted community members across Stanislaus County. So if you're looking at the agreement, there is 2 pages attached to the scope of work that are listing various objectives. So the county, while the objectives and targets represent the fundamental intention of the agreement, we do want to note that the proposed activities may change over time and do not represent an exhaustive list of the activities. We recognize that the housing and financial landscape is always changing, and we understand and support the need for STEP to have flexibility and versatility in meeting the objectives of the agreement. Some of the key terms of the agreement, there will be quarterly and annual reporting provided by STEP. There will be a county representative as a voting member on STEP's board of directors, and that will be designated by the county's chief executive officer. And then a total of $5 million will be paid to STEP. The initial payment will be $2.1 million upon execution of the agreement. About $600,000 of that will be going to help establish STEP and run its core initiatives. And the other $1.5 million will be there to support the objectives and target goals. There'll be an additional $400,000 paid in July of 2022, and then the remaining $2.5 million can be accessed at intervals by STEP using the following procedure. STEP would be submitting a formal request to the county and outlining how that that request would meet the objective, target goal, proposed activity, and measurable outcomes. The county would then review or deny that request within 10 days, and the chief executive officer would be designating the staff responsible for the review of that request. If approved, the payment would then be issued to STEP, and if it's denied, STEP would then have an opportunity to update that request based on the feedback and resubmit that. So on the staff recommendation side, there are two before you today. The first one is to authorize the chief executive officer or his designee to execute an agreement and any amendments thereto with Stanislaus Equity Partners, Inc., to provide services to disproportionately impacted communities in Stanislaus County in an amount not to exceed $5 million, and then to also direct the auditor controller to make the necessary budget adjustments per the attached budget journal. So that concludes our presentation. Happy to answer any questions that the board may have.
I'm sorry. I was reading something really important on this. Any questions of staff? Questions?
No questions of staff, yeah.
Okay. So I'm going to go ahead and open it up to, you have comments, though. I can see that already. I have one speaker card, Mr. Miguel Venoso.
I want to clarify, sir, I'm opposing the proposal. I just have a few questions in regard to the way it's being handled. Number one, I think this part is regard to the executive order 13995, regard to the mandate from the executive order. I know the letters, my writing is very difficult, but I'm telling you verbally the sense of the content. Under that, 13995 say to how the community in regard to COVID-19, especially underserved community, they are not receiving the funds they're supposed to receive from the 2020 problem of COVID-19. You have to remember that the Mexican-American Latino community was hit by the COVID-19 over 73% are sick. In the county, for the last year and a half, coming to 2021, still refuse to see our problem in regard to health, jobs, economic stress, problem of mental health, problem of health problems. Still the county refused, and Mr. Hayes and his staff still not report to you how they affect that done to our Mexican-American community. But now you have this agency, they're going to be the one they're going to supersede or help the whole Latino community of Mexican-American in two items. One is the housing issue, and the other one is the economic. So it's very hard to understand the one going to oversee the other one when we know the biggest problem that we face in this county and through the state is the housing issue. Already the people from the real estate told you it's a big problem, not only here, but through the whole state. So this agency is supposed to have the solution and in doing the mini macro housing, the so-called village, small village houses. That means it's going to be, what, 2 or 3 people in one house? It's mean the later, because of the problem, they don't have housing, our family is going to be 2 or 3 families living in this small village. The other one is, the big problem that I see is not only the economics, but saying they're going to give help to resolve the problem of the economics of the Mexican-American Latinos, and maybe later to have wealth, to be able to buy a nice house. And I think that's a little bit questioning. So the bottom line is the so-called conflict of interest that for sure is going to be Mrs. Roach to be appointed to be in the board of this new board directors. So that's because the guy that's going to appoint that person is Mr. Hayes. In the same time, Mr. Hayes is going to oversee the funding. In the same time, going to appoint maybe Mrs. Roach to be in the board. How come you not do the same thing to the Stanislaus Opportunity Board? How can you not do the same thing to the Stanislaus Community Foundation? Say, yes, man, we're going to give you money. We need to have a staff set in the board. So some kind of discrimination. Finally, you're going to give $5 million to our community, the only Mexican-American group, and now you put in condition. It had to be, if for sure, going to be Mr. Rocha sitting there. That's conflict of interest, because coming from him to her, and her going to that board. And that's not right. How come you not doing to the Stanislaus Community Foundation? How come you not doing the same thing to the Stanislaus Opportunity? So, a lot of questions. I don't have time, and I know just already put the time. So, I'm against the proposal, but I'm questioning a lot of the process they're going to be. And I think we need to think about it. And I know you already approve it, and you're going to approve of that, because you do over all the time, 95, 98%. You are rubber stamp. Thank you, sir.
Thank you very much, Miguel. Do you want to respond?
Yeah, Mr. Donoso, just as it relates to board representation, it's actually not uncommon for us to make this type of a request for this type of an investment. We do the same thing on the Gallo Center for the Arts Board. So we, as part of our agreement with the Gallo Center for the Arts, they are required to maintain a board position for us. In addition to that, I think I heard you mention Opportunity Stanislaus. We've already communicated to them our intent to seek board representation there as well. So we've already done, I think, what you're suggesting or asking there. And we have an agreement coming up with them soon where I would expect that to be codified. So just wanted to clarify that.
Yeah, and I would just add with regard to Stanislaus Community Foundation and our Stanislaus 2030 initiative that we have going now, that actually two of us, myself and Manny, are on the executive committee for that organization, for that committee that we're working on. Yeah.
Okay. Anyone else to comment? Please come up. Steve?
Okay, just for the record, my name is Stephen Morrow. Because I've spoken at board meetings and in private about the housing issue, which is a big, big crisis. So I'm glad to see that something's getting underway to try to help. But I'm wondering, is this part of this group's mandate? Is this going to be help people to qualify for a mortgage and raise the down payment? Because it's wonderful if we build houses, whether they're tiny houses or mansions, but if the community we're trying to reach is not able to qualify for a mortgage, then it's really going to be all for naught, because then we're going to have the same thing. We're going to have Bay Area investors coming in and paying cash and then renting the things out at exorbitant prices, and that's not going to help home ownership in this county. So is that would be part of this group's mandate, or is that going to be addressed maybe with a financial institution or something else in the future? Thank you.
So I think I do just need to point back to our work on the Housing Stanislaus program, that we would expect to be working on all these policy issues that relate to the upper half of the housing continuum. Been a lot of conversation and effort around the lower half of the housing continuum on homelessness, but I think these types of questions and issues will be addressed through that forum within the next 10 months.
Thank you very much. Anyone else? Seeing none, I'll bring it back to the board for comments. Supervisor Withrow.
Just a couple quick things. It's so good to see this moving forward and things starting to happen here. I think some of the crucial stuff that we'll be doing here is, and I know that in my mind, government is never the answer. That it's really it's going to take the private sector, the nonprofits, but we're there to help facilitate and help make these things happen. And so, one of the things that I really am looking forward to is just when we talk in here as far as our number 5 here with the provide economic resource development services to individuals and businesses, particularly those in the at-risk and minority-owned categories, including access to capital resources and technical assistance. And I don't know how many times I've said this over the last 18 months, but it was never more obvious that the lack of access to, to capital and resources and technical assistance for disadvantaged communities, that this money that the government has been printing and handing out just wasn't getting there, not for anybody's fault. But I really look forward to this, our ability to get out there and educate and help our disadvantaged communities, minority communities, to have access to this capital and the ability that all of us, many of us, were able to access during this last 18 months. And so this is a big part that I think is exciting of this. And I know we've got plenty of other things that you guys will be working on. And I know there'll be many successes and failures as we do this, because as we so often are, we're making this up as we go along, right? But our heart's in the right place, our intent, and now our resources are in the right place. And I expect that we're going to have some things that just fall flat on their face, but we're going to get up and we'll move on, and we'll have some things that are great successes. And so, and I think that's what's great about we're talking about quarterly and annual reporting. We will constantly be reviewing that and seeing how are we doing, what's working, what isn't working, where do we make course corrections. So excited about this, and not to expect that it's going to save the world, but it's a good step in the right direction, and we just need to be ready for the successes along with the failures, and be able to make those course corrections and keep us all informed as that's going along. Nobody's going to be upset about the failures. That's how we all learn. And so I look forward to this as it moves forward.
Can I ask you a question? Supervisor Withrow, you're on a bank board, and they have Community Resource
Act, the CRA funds.
CRA funds.
Right.
And those will be eligible to potentially
So we
fund?
think that these monies, we hope, many banks, will be able to invest their funds. And it's a requirement of the banks in order they have to have a certain amount of this investment in these disadvantaged communities. And so this will be an opportunity for them, a local opportunity for them to locally invest these funds. And so we're hoping we can get many banks here locally, including Oak Valley Community Bank.
Yeah, not just, and it wasn't for that, but some of the money was leaving our community because there weren't opportunities, right?
Right, and it's something that, like I said, each bank is required to do, and they're looking for things to do, and this will just be, we can hand this to them. This will be perfect. So
great, that is fantastic. Any other questions, comments? Hey, this is fantastic. Again, the ability to get capital is difficult for just about everyone in this economy. And, I heard lots of stories this morning about people potentially losing their jobs. And having an easier path to getting it doesn't, you still have to pay it back. It's not anything that is free, but this is changing the rules to make it available to all people, not just some of the people. So we do appreciate all the effort. I think this is as exciting a thing as we're going to do. I hope that we don't fall flat on too many. Hopefully we've thought of some of these issues, and Joe has been through this before, so appreciate it. All right. If not, I'm going to, no other comments, bring it back to the board for action.
I'll make a motion to approve.
I will second that.
We have a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Thank you very much. I'm going to move on to item 8.2, approval to rehire Cheryl Mello for prior to the 180-day sit-out period. I did see Cheryl here earlier. There she is. You were over here earlier.
Good afternoon. Kashmir Gill, County Auditor Controller.
Hi, Kashmir.
Hi.
Sorry.
I'm here today to request approval to rehire Ms. Cheryl Mello prior to the 180-day sit-out period as required by PEPRA. And PEPRA stands for Public Employees Pension Reform Act. On October 5th of this year, the board approved the contract with AST to assist with the implementation of the new Oracle budgeting and financial system. As part of the 2020-21 proposed budget, the board had also approved a time-limited confidential assistant 4 position to support the project. Recruitment of this time-limited position has been unsuccessful. Attempts to find a qualified candidate has been challenging, and the single offer made was declined. Ms. Mello has expressed an interest in filling this time-limited position as an extra help employee. She retired on October 9th after 21 years of county service. At time of her retirement, Ms. Mello worked as a confidential assistant 4 in the Chief Executive Office. The need to fill this administrative role is urgent as the implementation has begun through its discovery sessions. With her experience, Ms. Mello will be able to provide immediate benefit to the project. I thank the board's consideration and am available for any questions.
I'm going to look at Cheryl and make sure she's not doing this under duress since you just retired. Exciting. Thank you for wanting to come back and help out. Cheryl, any questions, comments? All right. Look forward to action.
Thank you.
I'll make a motion to approve.
Second.
Oh,
I'm sorry.
oh yeah.
Oh.
I'm sorry. Public comment. I apologize. Anyone in the public want to comment? I'm sorry. Yeah. Hey, no one's ever accused me of being too bright. That's for sure. All right. Seeing no one, back to the.
Got a motion.
We have a motion?
Second.
And a second. All right. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Welcome back, Cheryl. Correspondence.
This board has received a letter from the Reclamation District Number 2091 regarding the resignation of Greg Nunes from their Board of Trustees.
Acknowledge receipt of letter.
This board has received a letter from the Stanislaus County Office of Education regarding their intent to sell property located at 524 Kansas Avenue in Modesto as surplus.
Refer to the Chief Executive Office and General Services Agency.
This board received 2 notices from the California Wildlife Conservation Board regarding a proposed grant to develop the San Joaquin Basin Regional Conservation Investment Strategy and their acquisition of 24 acres of wildlife located in Stanislaus County, identified as Assessor's Parcel Number 008-042-010.
Refer to the Fish and Wildlife Committee.
This board has received a letter from Slogan Containers Manufacturing regarding their temporary layoff of its employees at its facility located at 3250 Patterson Road in Riverbank.
Refer to the Department of Workforce Development.
This board has received the claims as noted on the agenda.
Acknowledge receipt of claims and refer to the Chief Executive Office. Are there Board of Supervisor reports? Any? Dun, dun.
No, thank you.
Okay. Thank you all. On to Legislative Fiscal Management Report, CEO.
No report today.
Wow. All right, we do have a closed session. Mr. Bose?
Yes, we have closed session this afternoon. We have 3 items. First is conference with the labor negotiator pursuant to Government Code Section 54957.6. The agency negotiators are Jody Hayes, Cameron Thomas, Pierre Vink, Burke Dunphy, and the labor organization is the Service Employees International Union Local 521. Do not expect a report out there. We have a conference with legal counsel, anticipated litigation pursuant to Government Code Section 54956.9, Subdivision D4. There's one matter there. Do not expect a report out. We have conference with legal counsel, significant exposure to litigation pursuant to Government Code Section 54956.9, Subdivision D2 or D3. We have one case there, and we do not expect a report out. Appropriate for public comment at this time?
Would anyone like to comment on any closed session items? Seeing none, I want to thank you all who have stuck around the whole time. I'm always very impressed, especially when we have long meetings. So we're going to adjourn to closed session.